Good morning. Today, on the eve of the Human Rights Day, we will talk about an important topic which is closely related to the human rights topic. We'll talk about the rights of key populations vulnerable to human rights violation in Georgia, Kyrgyzstan, Tajikistan, Moldova and Ukraine. We'll talk about the situation and about the response. My name is Maxim Butkevich. I'm a human rights activist and the national coordinator of the REACT project in Ukraine, and I have an honor to be a moderator today. So, organizer of this meeting is Alliance for Public Health. And we would like to thank the regional SOS project and the Global Fund to fight AIDS, tuberculosis and malaria for support, as well as frontline AIDS. Today, for the first time, we'll present the data about human rights violations collected in the 5 countries with the help of the REACT tool, a unique system to respond to human rights violations of key populations vulnerable to HIV and TB. In a year of project operation, there were about 2,000 submissions registered from people living with HIV and other key population members. Today, we'll present analytical reports for Georgia, Moldova, Kyrgyzstan, Tajikistan, and Ukraine, depicting the key trends and the nature of the violations of human rights against key populations, as well as recommendations to improve the situation in each of the countries. The reports will be published on a website, which you will see on your screen, react, aph.org. So the key goal of our event today is to join our experience in different countries and improve the efficiency of our human rights activities. So this event is carried out on the eve of the Human Rights Day. We would like to remember that Article 25 of the Declaration on Human Rights, which is especially important today. So Article 25 underlines that every person has a right to health care, and it is the basis of operation of the World Health Organization as well as all other international bodies in health care. But based on the REACT findings, the key violations of human rights are violations of human rights in healthcare institutions. That's about as well as law enforcement bodies. It is about 45% of cases. Discrimination and unlawful actions in healthcare institutions, that's 26% of cases, as well as physical violence against women, both from the side of their sexual partners and relatives and police officers. So this violation accounts for about 20% of the reported cases. So during today's meeting, we will have a simultaneous interpretation into English. So we'll have our event on Facebook and on YouTube, and in the first comment you can see the links to the events in English. So, and also if the event that you are watching is in English, you can see links for Russian translation in the first comment. So I would like to give the floor to Andrei Klepikov, Executive Director of Alliance for Public Health, for a welcoming word. So the floor is yours. Thank you. Good morning, dear colleagues, dear friends. Today we have a unique meeting. Though it is in the virtual format, it still gives us the feelings of their realities that we have in the countries of Eastern Europe and Central Asia. In Ukraine, in particular, in terms of human rights. And the results that we will present today are quite shocking. There were almost 2,000 cases reported of human rights violations in the region of Eastern Europe and Central Asia. Out of them, 775 cases were in Ukraine. That's the biggest share. And we have this meeting on the eve of the International Human Rights Day, and it is not possible to curb the epidemics of HIV and tuberculosis, at the same time continuing to violate human rights, criminalizing key population and marginalized populations, and continuing with gender inequalities. So we cannot fail to act. And the questions that we have to discuss today is an effective tool called React, which allows not only monitor human rights violations on a timely basis, but also adequately to respond to them. The uniqueness of this tool, React, is that monitoring of human rights violations is performed by the communities, people who are directly interested to stop such violations and prevent them in future. This is the information which goes directly from the community without censorship. That's truthful information, and that's why it is valuable. So those are not some extracts. This is direct speech and direct evidence from people whose rights are violated. This tool allows not only to store information on a confidentiality basis and make it accessible only to monitors who are engaged in this project, but also it allows adequate response to human rights violations, both at the individual level and at the systematic level, making changes in policies, in healthcare facilities, and in the healthcare system in general. The number that I would like to give you is that over 70% of all human rights violations in the region are related with government agencies, such as police, healthcare institutions, and others. It is also worrying, and unfortunately, COVID pandemic only aggravated the trends we have observed before in terms of growth of the barriers and growth of human rights violations, in particular in terms of barriers in access to health services. We have special concerns about the cases of physical violence. That is a direct threat to human health and human life. We see that vulnerable populations, people who use drugs, women engaged in sex work, men who have sex with men, people living with HIV, they are the ones who have the highest risk of human rights violations of their fundamental human rights, which are reported in React. That is a living operating system. It works already in 5 countries. And this is the system which we plan to scale up and expand and launch it in new countries. So I hope that the discussion that we're going to have at this conference will allow us not only to continue the work in Ukraine, Georgia, Moldova, Kyrgyzstan, and Tajikistan, but also to expand this functional tool and cover a number of new countries. I would like to say thank you to all our partners. First of all, those who work at the front line, those who report human rights violations. This is critical information, very valuable information. So I would like to thank our social workers, representatives of the key populations which are directly involved in this project, also all the partner NGOs, and of course our partner in implementing and developing this tool, which is Frontline AIDS, So this tool was actually adapted based on the tool initially provided by Frontline AIDS. And also I would like to thank our donor who made these activities possible. This is the Global Fund, which allows us to focus on the key strategic goal of observing human rights and achieving gender equality. That is one of the focuses of Global Fund activities, and that is the fundamental area of its work. And without it, it is not possible to curb the epidemics of HIV and tuberculosis. Thank you. Thank you, Mr. Klepikov. It is very important that from the very beginning we underlined the challenging environment where our field colleagues are working, and they make it possible the REACT tool to work in 5 countries of the region. So we mentioned our partner organization Frontline AIDS, and our next 2 colleagues will speak in English, so I will talk to them in English also, and people who listen to us and watch us in Russian, they will hear translations, so please do not be surprised. You will hear my words, but not my voice.
A colleague and friend, Enrique Restoy, head of evidence at Frontline AIDS organization. Welcome, Enrique, and yes, you have a flow. You can talk now. We are online.
Of delay, but hopefully you're all right.
Welcome, Enrique.
Thank you very much. Thanks very much. Excellent. Thank you so much. I would like to start by obviously thanking Alliance for Public Health for the opportunity of being in this very important event. I'd like to thank obviously the partner organizations in the SOS project. As Andrei said in his presentation, this is about communities, and it's great to have you. So I hope you. Sorry. Yeah, and I would also like to thank the Global Fund for supporting this hugely important work. I come from Frontline AIDS. Frontline AIDS is a global partnership of independent organizations working on HIV. Alliance for Public Health has been a leader in the partnership for many years, pretty much ever since it was created. So it's a real pleasure to be here today. Our partnership works with marginalized people, and it is marginalized people who are most affected by HIV. But we know that very often vulnerability to HIV brings also vulnerability to human rights abuses, stigma and discrimination. And therefore, human rights is at the center of how we conceive the response to HIV. I've been asked by Alliance for Public Health to talk a little bit about the evolution of REACT, how it was created. And as Andrei said, I feel a little bit like the startup creator that really comes up with an idea in a garage. And then a few years later, it comes back to see what happened to it. And it's like, I can't recognize this. It has been taken to a completely different dimension by, in this case, by Alliance for Public Health and the partners. So it's really great to see it. Maybe because we are very close to Christmas, in this very short presentation, I can really talk a little bit about make a parallel between REACT and Christmas Carol. I don't know. I'm sure everybody has read the book by Charles Dickens. I'm based in the UK, so I can really make the connection. And we can talk about the spirit of past Christmas and past REACT, present REACT, and future REACT. And the good thing about that is that ever since it was created, the very notion of evidence collected, owned, by communities has remained, and it's great to see it in the SOS project, how it's still the case, even though this human rights monitoring and response system is being taken to scale by Alliance for Public Health and the partner organizations. The very essence of being community-led and community-owned has remained, and that's very good. If you allow me, just when we're talking about the past of REACT, it all started in a visit when I was working with LGBT organizations in Uganda. And at the time, we were running an HIV prevention program in that country. And I remember sitting with the director of Sexual Minorities Uganda, Frank Bugisha, and he was saying, you know, he was constantly interrupted. We were talking about the prevention program, and he was constantly, you know, on the phone, trying to sort out very, very pressing emergencies, like somebody being taken to hospital and needing some fees to pay for it, people who needed shelter. And it was very weird to say that, to have to be in that conversation, because really we were talking about money that was for HIV prevention, and yet much of the time of the organization was trying to sort out the violence, the discrimination, the violations of the rights of the people who were supposed to be in that program. So we came together and thought, okay, we really need a way of getting the evidence about what's happening, not only for advocacy, obviously, to change the situation of the harassment of LGBT people in that country, but also to be able to go back to donors and to create a program about the actual needs of the populations, with the understanding that without really addressing the human rights situation of clients of a program, it will be impossible to control HIV among that particular population. And that's how REACT started. Now, coming to the spirit of present REACT, as it's being developed by Alliance for Public Health, this has changed in the sense that it has become a system rather than a tool. It is a system for providing responses, human rights-related responses to people affected by HIV, and it is embedded into the human rights programming of organizations implementing in REACT. So it does have a component, obviously, of organizations being able to collect and provide robust evidence on human rights from a human rights language perspective, but very much based on the work of the organizations on a daily basis. You know, peer educators, people, outreach workers working directly with their clients and collecting information from them, and all be based on the needs of the client, in the sense that, and I'm very proud to see that also with Alliance for Public Health, that yes, it is a lot about providing evidence, but it's a lot about providing evidence to help the response, to help with the referral system to human rights services, to help the organization follow up on the impact of the human rights programming, to follow the individual in the support that they provided. And that, for me, is one of the great qualities of the system. And you will see a lot of stories from Alliance for Public Health and their partners about that particular aspect of the program. Obviously, Andrei has mentioned the over 2,000 cases of human rights abuses in the region that is being collected so far through the SOS project. In the last year or so, we've been able to implement REACT in 10 countries. So it's, the cases are beyond 2,500. And we've been able to see how it has been clearly customized per individual situation and per individual community, per individual organization. And that's another thing, I think, interesting feature about the system. And actually, it is very different systems depending on the country and the communities that are being served with it. It's been translated into French, Portuguese, Russian, Ukrainian, Georgian, Arabic, a lot of observation when it comes from Alliance for Public Health. And the important thing about the system is that it has a very strong component of sustainability. we were mentioning about community ownership. A very important part of community ownership is to be able to maintain the system, maintain the work around human rights and collecting evidence of it without having to depend on a particular stream of funding or another. That is really a very important part of independence. And I'm glad to hear that most of the organizations that started using React as part of the community response to human rights have been able to maintain the system over time, in moving it from project to project. For example, the very first ones that I mentioned before, Sexual Minorities Uganda, has been using it without interruption for the past 7 years. So I'm going to stop here just with a word on the spirit of future React, and I think that belongs to Alliance for Public Health. Andre really mentioned scale up, and I think that is the next frontier for this reporting and response system. Being able to not only to scale up to other countries so that the evidence can also help see the comparative trends of countries in the same region, but also to be scaled up at the national level, to be embedded into the monitoring and evaluation systems at national level, always with what the technology that we use in React has allowed us to have, which is the autonomy for communities to decide when and how they share very sensitive information with other stakeholders. And this is the beauty of it. We know there is a lot of opportunity to incorporate this system into the national response, but also understanding that communities also really need a degree of autonomy about the data they have, and also paramount the client's needs and rights in terms of confidentiality and the use of their own information. So anyway, I think this is over to you guys. I'm sure this event is going to be incredibly interesting. I'm very, very much looking forward to hearing from you and from the partners. And I wish you a very successful event. Thank you.
Thank you very much. And yes, it was very interesting also to hear how the system arrived into being the same one which has been as flexible as it is, accommodated in Ukraine and other countries of the region. And for the next word, I invite Keith Minis, who is the technical advisor, community systems and responses in the Community Rights and Gender Department at Global Fund to Fight AIDS, Tuberculosis and Malaria. Mr. Minis, you have the floor.
Thank you. Thank you so much, Max, and thank you for the invitation to be here. I'm really excited about today's event to showcase the advancements that Ukraine has made in community-led monitoring. Just to say again, my name is Keith Minis, and I'm a technical advisor in the Community Rights and Gender Department at the Global Fund. And I'm also a workstream lead on the new and very exciting community-led monitoring strategic initiative, which will begin implementation in early 2021. Ukraine has been a leader in the region in community-led advocacy and monitoring, and in comprehensive responses to human rights-related barriers as part of the Global Fund Breaking Down the Barriers initiative. The midterm assessments carried out under the Breaking Down the Barriers initiative has documented significant progress in scaling up human rights programs, including monitoring and responding to human rights violations. The midterm assessment also identified areas for improvement, including the need for greater coordination and sustainability efforts. And so Ukraine will receive long-term support to strengthen existing CLM mechanisms, including the React model, which will be discussed today, while also strengthening new and innovative community-led monitoring models around quality, accessibility, and acceptability of services among program users and service users as services are transitioned to government support. Overall, the strategic initiative is really focused on making programs more effective, responsive, while also empowering communities to hold decision makers to account, contributing towards advocacy for change, and improvements linked to health outcomes across the three diseases. The advancements that's been made in community-led monitoring in Ukraine provides a very good starting point to respond to further needs around monitoring of availability, accessibility, quality, and acceptability of prevention services that government is taking over as part of the transition process, contributing to the global good and body of knowledge through dedicated long-term technical assistance and support over a 3-year period worth roughly $250,000. The learnings from supporting Ukraine and its contribution to the development of normative technical guidance and tools for community-led organizations to conduct community-led monitoring will be instrumental. I'd just like to say, before this technical assistance will be delivered, several landscape assessments will be conducted, including in the Ukraine, to map existing mechanisms of community-led monitoring, the implementers, the donors investing in community-led monitoring and system strengthening, and to identify needs around program design and implementation, which will allow us to develop a context-specific and needs-based TA work plan over the implementation of the SI period. The assessment will address 3 broad queries using information from key documents and interviews from country stakeholders. What CLM is taking place, really a descriptive exercise aimed at understanding who is implementing it, supporting it financially or technically, what is being monitored, what tools and methods are being used, and how the results of monitoring are being used, how it's going. And this event is certainly helping us to shed some light on that and where the major successes are and weaknesses remain. And this is an analytical exercise to understand the capacity of community-led organizations and communities themselves to conduct community-led monitoring, including data collection, effectiveness of use of the results and analysis, and also to support advocacy using community-led monitoring data. The TA needs would then be articulated by implementers themselves and other in-country stakeholders, including technical partners and civil society, to help ensure that we best match with TA providers and inform TA work plans accordingly. There'll be a big increased focus on sharing and learning, generating evidence, and eventually setting up a community of practice for community-led monitoring beyond the long-term support countries. The Ukraine HIV and TB programs will benefit from this as much as others will benefit from its experiences, learnings, and challenges. I'm particularly excited about the learnings from REACT, the best practices and the worst practices too, to help other countries make these advancements without starting from scratch. Like yourselves, to contribute towards the transformative and sustainable agenda of community-led monitoring and communities at the center of the epidemic. Some of that knowledge sharing is already happening in the frame of the multi-country grant for sustainability of HIV services in EECA. And we are hoping this could be further amplified with the support from the strategic initiative. Thank you again for the opportunity to make some opening remarks. And I'm really looking forward and excited to continue working with you in my new role and through the strategic initiative over the next 3-year period, together with my colleague Alexandrina, who's the community rights and gender focal point for the region. Thank you.
Thank you very much, Keith, and thank you for bright perspectives you've mentioned in your greeting, in your opening word. And now we'll switch to Russian language, so those who watch us in Russian will hear my voice in Russian, and those of you who follow us in English will hear simultaneous interpretation. Переходим.
So now we're switching to the Russian language, and it has already been mentioned by all our previous speakers that there is a big role of the government structures. Of course, we cannot speak about improvement of the situation with human rights without trying to somehow amend the policies without the cooperation with public agencies that play the key part in this issue. Now I'd like to give the floor to Mr. Igor Kuzin, who is the acting Director General of the Public Health Center of the Ministry of Health of Ukraine. Mr. Kuzin, please. Mr. Kuzin, are you with us? So we have seen that there was a technical delay. And I think that in this month of this event, so we have got used to such things, and I hope that now a bit later Mr. Kuzin will actually join us and we'll try to establish connection, or if he is already connected, please let him speak. Mr. Kuzin. I've been informed that Mr. Kuzin is trying to connect to our event, but we do have a technical delay, so we'll make just several seconds of pause to let him get connected to us, because of course his welcoming words would be so much desirable, because we speak about the head of the key agency in Ukraine concerning observation of human rights of people with tuberculosis and HIV, especially before this memorable day. Now, yeah, we do have some technical problems with the connection, and considering that we have limited time, let us now switch to the discussions, and I hope that later we'll be able to return to the correction, to the connection with Mr. Kuzin. And now for the discussion, we have a limited amount of time, and the same goes for every session that we have. And so for the convenience of our speakers and our audience, we need to show a timer that will do a countdown. Don't be afraid, it's just for the convenience. And now I'd like to give the floor for the first participant of our speaker in this session, Marina Novachuk, Senior Advisor of the Country Office of UNAIDS. Madam Novachuk, please. Yes, thank you very much for the invitation. Thanks to all the organizers and hosts of this event. Now, on the eve of this important day, International Human Rights Day, and I'm glad to be present here and speak on behalf of the United Nations AIDS program, on behalf of our country office, and address such important issues as monitoring, collection of strategic data, human rights, and key populations, and intersections of the above. Now, I'd like to ask you to show the slides, to have a visual part of my presentation here as well. So in my 15 minutes of speech, I'd like to speak briefly about the past, about where we came from, look at some current challenges, and look into the future. Why is it important to take a glimpse at the past? Because then we will not lose the milestones, the key values that we must keep at our heart while we are moving forward to achieve a successful response to HIV and AIDS. So where have we come from, and our main principles for collection of monitoring data and creating strategic information? Since the time the UNAIDS was created, people living with HIV, people representing key populations, populations that are directly affected by the epidemic, HIV, AIDS, and tuberculosis, and co-infection of the two, they are the locomotive for creating the evidence base. And it is thanks to this involvement of people affected by the epidemic that we can develop and produce data allowing us to have a good understanding of the epidemic, where we are now, where it will be tomorrow. And this correct understanding of the epidemic and the response allows us to set up the correct response measures. So that it means right actions in the right place, with the right scope and the right focus on the key populations. And without involvement of the communities, without the involvement of people living with HIV or affected by the epidemic, it would have been really hard for us to have created such evidence base. The next slide, please. Throughout all this time, we have been learning some lessons that help us move forward. The first lesson is that we need to set up, even though this topic of human rights is very difficult and ambiguous sometimes, something that was introduced in the HIV response and has moved it out of purely medical framework, also adding the human rights, education, and law enforcement agencies, and so on, other factors of the epidemic. To achieve the effect, we need ambitious goals because they let us go on, move forward, build the plans, ask and provide resources for the response. We need also for countries to play the key part, because in the countries where they collect the data, verify it, and hold it. The country needs to be the owner of the information. We need also to connect this with the information so that we could somehow implement new responses, new measures of response, because like everywhere, it requires additional efforts, additional negotiations, and it's been not too long ago, it was 3 years ago, and that was implementation of PrEP measures for key populations. For that, we needed data, real-time data, the data that would justify and provide information. And that was truly necessary. So the strategic information played a key part, collection of the data and provision of this information to the people who make decisions, to decision makers, to those who allocate resources, who change the directions of programs. And even though the programs have already been approved, but based on the strategic evidence, they can reallocate resources and approaches. These lessons are of great importance. And throughout all this time, and a lot of time has passed, a lot of success has been achieved in terms of data monitoring from the time of unprecedented meeting on HIV by the General Assembly of the United Nations. A lot of indicators have been created since 2015 or 16. A lot of indicators also concerning human rights, policies, legal framework, stigma, and discrimination. And all the countries submit this information. UNAIDS has developed a system. The system has been improved, and it includes a unit on policies and aspects related to legislation. And it was called NCPI. It was reworked in 2007, but always it contained a part where the NGOs could submit their opinion about the situation in the country. From the very beginning, the role of the communities was always emphasized and was really important, and it was presented through shadow reports, or in the new NCPI there was a unit A and unit B, where in case of discrepancies between the vision of the response and successes, the country could submit 2 reports from public authorities and from NGOs. We as UNAIDS always are for the dialogue in the country, for the data to be discussed and for solutions to be found. The information has been refined. We have much more of it now.
And such a tool as the stigma index also was improved. It is also a unique tool which was developed by the community. In 2018, it was revised and expanded, and now it is even more focused on the key populations. Marina, I'm sorry, at some point we lost the sound. Could you please check if the sound is on? Maybe you could do something with it. Can you hear me now? Yes, we can hear you now. Okay, so what slide? At what slide did you lose me? Did you lose the sound? Well, so I will probably continue. And I think that if people have questions, they will be able to ask them later. So that is what was done in the past. So we always used the principle of community engagement. It has always been the focus of our work. And for us, it was crucial as well as for other partners. So a lot of things were done and a lot of things changed. But as we know, we still are not reaching 2030 targets, and the situation in our region is still to be improved. So we need to also improve the information. And here I would like to talk about the challenges that we have today. And I would probably say that if we cannot stop the epidemic sometimes, so the problems can be sometimes about the programs themselves. So sometimes they might not be effective, or maybe the statistical information does not inform the program, does not influence allocation of resources, or maybe there is no dialogue. So a possible response for the such challenges in the world and in our region could be integration of different flows of strategic information, because there is a lot of information. So what could be important, and an example could be this React project, to make information real, to make it goal-focused, and to take information from different sources. Like in Ukraine, just recently, the 4th report was prepared for stigma index on HIV, and this report, this data should be used for today's tasks. So to combine it with results of smaller studies on chemsex, on sexual education, on gender violence, and prepare analytical reports which could advocate for the changes of policy with policymakers or with decision makers, people who make decisions on ART regimes for stable patients. So this should be information in the real time. It should be formed based on specific tasks. It should be accessible and accurate. And of course, it should be evidence-based. That is one approach, and an example of this approach can be the new initiative of UNAIDS HIV Policy Hub. Here we're talking about taking information from different sources, analyzing it in the real time, and using it to advocate for policy changes so that we could move from the point where we are now, because still in our region we have a lot of barriers related to the regulatory framework, to the legislation which does not provide more expanded access to services. So on one of the slides you can see an example of such studies, and so HIV Policy Hub is already operating, and this approach is very important. The second approach, which has been mentioned today by other speakers, is engagement of communities in the monitoring and data collection. This approach is not new. Yet it is very important, and UNAIDS, the program where I work, we published another practical guidance to engage communities in monitoring. That is a critical task-oriented, and this approach will enable more effective use of resources, which is important in the situation of limited funding, in the situation of COVID pandemic, when our resources are limited. And of course, such approach is based on the ability of the community to collect the data, to use it for advocacy. And advocacy is not the final goal of this work. We need advocacy to change programmatic activities, to change resource allocation, so that finally we can curb the epidemic, change its trajectory. And I would like to have a glimpse of future and to underline the importance of monitoring for the key populations and situation monitoring in terms of human rights violations, observance of human rights. Now UNAIDS is building another global strategy. Well, it's not our strategy, it will be a global strategy for all the partners. And from the moment of its creation, UNAIDS has been working with other partners, and now we'll have the next strategy for 2021-2026, which will include new goals, the goals of 2025. And here a part from the new targets will have 10-10-10 targets, and thus we will make even a stronger focus on the goals focused on the human rights aspect. So we want to ensure that we want to have less than 10% of people living with HIV facing stigma and discrimination. We want by 2025 to have less than 10% of people facing gender inequality and gender violence, and less than 10% of countries which would have legislation containing barriers in access to services, treatment, and prevention. So those are the ambitious targets we want to reach, and we will not be able to reach them if we do not engage communities which will help us to monitor our movement to such goals. So thank you for your attention. Thank you, Marina. Thank you for your interesting presentation about monitoring of human rights violations and observance of human rights in the region. Dear colleagues and our Dear participants, if you have questions to Marina, or maybe you will have questions later, you can ask them in the comments to our broadcasting. And at the end of our event, we'll have a separate Q&A session where we will be able to ask questions to Marina. Marina, thank you again. And my colleagues helping us with the technical side of our event, and without whom this event would not be possible. So they tell me now that now we have connection with Mr. Kuzin. So Igor Kuzin is Acting Director General of Public Health Center at the Ministry of Health of Ukraine. So Mr. Kuzin, the floor is yours. Dear colleagues, good morning. I'm happy to be with you, and I'm sorry for the small delay. Unfortunately, now most meetings are in the online format, so sometimes there are some delays. So on behalf of the Public Health Center, I would like to welcome our today's event with a focus on the rights of the key populations in Ukraine and in Eastern Europe and Central Asia. Really, for the government now, it is important to ensure sustainability of such services, such programs, and pay attention at the activities related to reducing legal barriers. And we understand and international literature shows us that systematically working on reducing legal barriers will give us better results than just implementing some prevention interventions. So Public Health Center now renewed operation of the working group which aims at reducing the legal barriers. So we have now members of this working group from among the staff members of our center, which work on reducing those barriers. And this working group now define the scope of its operation. It has three main areas of work: monitoring and evaluation, and everything related to the cases of human rights violations. So this is the group which works on regulatory documents. This is a group of lawyers and writers who help us to gradually change our legal framework. And the last component is advocacy and communication and social mobilization. That is also very important. So now this working group has regular sessions, and by the end of the year, we are planning to publish a detailed report about what we have done since 2019 to 2020 in the area of response to human rights barriers. Of course, there will be certain gaps, and we are certainly ready to address the things which we have not been done yet, so to fill in those gaps in the coming years in line with our national plan. And within the working group sessions, we pay attention always at the information systems. And here it's important for us to underline that REACT, One Impact, Data Check, databases as platforms to collect data are very important to us, and we will support their implementation. And I'm happy to say that Public Health Center now is signing a number of strategic memoranda aimed at consolidated and comprehensive processing of complaints of patients who are facing human rights violation. So this is a memorandum with the TB people, with 100% Life NGO, and I think that we will also try to formalize our relations with other human rights initiatives and organizations to address legal barriers. And the last thing I would like to speak about today is that together with the principal recipients of the Global Fund, such as Alliance for Public Health and Network of People Living with HIV, now we are working on an advocacy strategy, and I hope that at the end of 2020 this document will be not only finalized but also agreed with our key partners. We are also supporting the global partnership, and I'm happy to say that Ukraine is an active participant of this process. So I would like to thank UNAIDS for being the driver of this change at the country level. So today I would like to wish all of us to have effective communication and information exchange and exchange of best practices, because really we have done a lot and we have even more plans for 2021, 2022. So I'm sure that such a platform is very important for us, not only to exchange information, but also to look for some joint ways to resolve problems. Thank you for your attention.
Thank you very much, Mr. Kuzin. Thank you for the welcoming words, and thanks very much for the things that we have heard, that the PHC is so much interested in human rights of key populations and in the support of the monitoring systems for monitoring of human rights violations, where you included REACT as well. And we strongly hope for cooperation of our continuation of our cooperation, for its fruitfulness, and the REACT as a system, as a tool for monitoring and responding to human rights violations regarding the rights of key populations is successfully implemented not just in Ukraine. There are 5 countries in the region where the Alliance for Public Health and their partners from NGOs implement the system. This is Georgia, Moldova, Tajikistan, Kyrgyzstan, and Ukraine. And by the end of 2020, and exactly this year, it is planned to expand the program in the EECA region to 2 more countries. So the partnership on REACT in the region involves a lot of NGOs who are our partners. Without them, of course, REACT system would not be possible. It exists only thanks to their work. It's 14 non-government organizations in Georgia, 9 in Moldova, 7 in Tajikistan, 13 in Kyrgyzstan, and 28 NGOs in Ukraine. Overall coverage of the project currently is 28 cities of Eastern Europe and Central Asia, and in these cities, the team of REACT, in addition to recording or documenting the claims of human rights violations, also helps resolving problems, responding to them, providing counseling to the victims of human rights abuse, and works as a mediator wherever it's necessary, and helps in communications with the law enforcement agencies wherever possible and needed. All the data about the work of the REACT project in the EECA region are available real time on the website, the new website of the project. You will be able to see the address of the website throughout our broadcast. It is react-aph.org, and more about what REACT is as a tool for monitoring and responding we will hear from the next speaker Olga Varetska, Associated Director on Strategic Information, Monitoring and Evaluation of the International Charitable Foundation Alliance for Public Health. Please, Olga. Thank you very much, Maxim. Good morning, dear colleagues. I hope you see me well and hear me well. I will not repeat the words of the previous speakers and focus on the very practical aspects of implementation of the React databases. Can I see my slides, please? Thank you very much. We can now get to this next slide. So what is React? Let's start with the basics. Why is it called React? That's an abbreviation, acronym of 3 words, rights, evidence, and actions. And these words reflect the whole essence of this database. So we need to get the evidence and respond to the information that we receive about violations of human rights. As a brief information, Frontline AIDS developed this tool, and it allows documenting and responding to the barriers which key populations face while seeking health services, dealing with law enforcement units, or in their daily life. The system is being implemented by the ICF Alliance for Public Health with the technical support of Frontline AIDS and financial support from the Global Fund. And this technical point, also by the end of 2020, legal rights for the database in terms of React project in Ukraine and EECA region will be transferred from Frontline AIDS to the Alliance. And in 5 countries of EECA region, this database has already been implemented and is being used. Also in 2020, there have been registered about 2,000 cases of human rights violations, including 775 cases in Ukraine. Now let's get to the next slide. Thank you. So what are the components of the system? As we have already said, this program serves, first of all, to ensure proper response to human rights violations. So first of all, we are talking about the responding, that is providing support to people whose rights have been violated. The second is reviewing or analysis of the documented cases and to see the situation broken down by countries in the region, types of the violations, and who are the violators. This analysis also tells us more about linking human rights violations cases with access to HIV/TB and other health services. This analysis also helps us to understand which particularly programs and interventions need to be implemented to prevent future cases. That can be, for example, training sessions, education of police officers or medical professionals who work with key populations and so on. And the programs aimed at protecting the human rights are increasingly more often included in the package of HIV and TB prevention. So they are integrated more and more in the programs and the projects. And it's correct, it's the right thing to do, because without both we cannot make the programs work. We cannot provide effective access to the services without protecting the key populations themselves. And the final point is the advocacy. That's directly the work with the public officials on amending the legal framework or changing the legal framework implementation practices. The next slide. About the features of React system. First of all, it's person-oriented. That is, the main entity in this database is a person, not a case, not an incident of human rights violations, but the experience of a person. And that allows us to record a history of cases, thus increasing the base of evidence. We got online, offline versions of the React, and you can also provide evidence with mobile app. You can collect information in the field without internet access and then upload the data later. The information is stored in the cloud, which prevents data loss or theft or system hacking. Everything is kept on the Amazon service. Another important point is security of reactors and clients. And the system does not have any personally identifiable information, so you cannot trace back to the client or the reactor. And the functions that we have implemented, such as logout, prevent this information from being stolen. Also, the database is very customizable, adaptive, which allows you to adapt the database to your local realities, and this is something that was done both in Ukraine and other countries of the EECA region. Another point is immediate response and cooperation. The cases get into the database as soon as they are uploaded, and they can be processed by a lawyer or other personnel who see this evidence in the real-time mode. And the final point, it's more about analytics. You can create a lot of visualization, analytics, a lot of functions that allow you to analyze and visualize the evidence collected. The next slide is about the implementation scheme. Here you see this picture of implementation of React database. So that's about how to clearly explain what we mean when we speak about this system and its implementation. For a more effective response to human rights violations, partnerships have been established in every country with the organizations who work in the area of human rights protections for key populations. This way, reactors were selected to register cases of human rights violations. Thus, React was organically integrated into the already existing service infrastructure and human rights infrastructure in every country. That is, it is fully reliable, fully relying on the existing projects and existing personnel. Next. So here we see how the React actually works. And to save your time, I will not go into deep detailing, but the key point is this central thing where you see as how the reactor, when he or she meets the client and completes the record of the case using a template. And here we have two arrows to the right and to the left. And on the right you see the monitoring function of the reactor, that is recording of the cases and storing this information and so on. And on the left we see the response component, the green boxes. It's either providing direct support or help to the person if the NGO has the necessary resources or personnel, or referring to other profile services, line services who can provide the necessary help. Also, feedback from the client is important. A case is not considered closed unless you have got the confirmation of the client who is satisfied with how the situation has been resolved. The next slide is about the example of visualization. That's an example of the maps, pie charts, diagrams that allow us to analyze the evidence. I will not be speaking about that at all because we are going to see a very detailed presentations that will cover the data that have been collected in the region and in Ukraine in particular. And the final slide, maybe, I'd like to speak now about what this piloting stage has shown us. We are now in the final stage of piloting. 2020 was the whole pilot year, and now we are starting a significant scale up. Nevertheless, a lot of trends have been obvious, and we need to speak about them. First is it's important that direct response is provided. It was important to see that service NGOs can successfully respond to the human rights violations of people who reach them in most of the cases, either by providing legal consultations or providing social support or through mediation or appealing to law enforcement agencies. On the other hand, where specialized needs had to be satisfied or referrals had to be made, implementation of React allowed building cooperation with human rights organizations at the local level, even where we used to not have any cooperation. There were service organizations and human rights organizations, but they did not interact. React opened the opportunity for the clients to find both types of services. And the third point is also very important. It's recommendations for law policies and interventions. During our next presentations, we will be speaking in more detail about what recommendations are already can be outlined based on the collected evidence. But now I will just say that React data enables systematizing and objectifying the cases of human rights violations. We have heard about such cases before. We get this information from the regions, but without systematization of the evidence, without somehow preparing proper database, we don't know how to respond to that. We don't know whether those cases are occasional, individual, or they have systemic nature. So this database allows us doing exactly that. That was my last slide. Thank you very much for your attention. And in the end, after all the speakers, there will be a Q&A session. Looking forward to that. Thank you.
Thanks a lot, Olga. Really, if you have questions during Olga's presentation or during other presentations, please leave all your questions in comments under our broadcasting on Facebook and on YouTube. So we are collecting all your questions, and we will have a Q&A session at the end of the event where we will ask your questions to our speakers. So now we have heard from our two speakers about the situation with the monitoring of human rights violations in Ukraine and in the region of Eastern Europe and Central Asia. So Olga just told us how the system works, how it is operating. We saw that the main components of the system are NGOs, which are in direct contact and interaction with key populations and populations vulnerable to HIV and TB, whose rights are violated. And really, I would like to underline once more that what Olga said. So even when we know that such violations take place, and sometimes we hear about them, only with the React system we started to collect this information in a systematic way and analyzing it in a systematic way. And in the first year, we can already see some trends, and we can understand where we should focus our attention talking about human rights violations of the key population. So we talked about the general picture, and now we will have a presentation of the reports on human rights violations in 5 countries of the region. And for the first time, these reports will be presented, but it will not be the last time they are presented. So now I give the floor to our next speaker, Tatiana Deshka, Director of International Programs at Alliance for Public Health, and she will talk about the experience of React implementation in Eastern Europe and Central Asia. So, Tatiana, the floor is yours. Thank you very much, Maxim. Dear colleagues, I'm very happy to present information about the React operation in Georgia, Ukraine, Moldova, Kyrgyzstan, and Tajikistan. At the end of my presentation, my colleagues will join us from a number of those countries, so please stay with us. We'll have a very interesting session now. So we will start with a little review about regulation and criminalization of HIV transmission, sex work, drug use, and LGBT orientation in the countries where our reactors started to work since the beginning of this year. So we have marked red the sections where the situation is critical and where regulations lead to human rights being violated. So for intentional HIV transmission, you can see that in all the countries there is criminal responsibility for HIV transmission, but in some countries the criminal articles are almost not used, and in others they are widely used, for example, in Tajikistan. Today, a presence of an article in the criminal code for putting a person under threat of HIV transmission, it is a big burden for people living with HIV. It is a big barrier in terms of access to health services for them, and it will we will come back to this question throughout our presentation. As for sex work, it is mostly regulated with the Code of Administrative Offenses. Administrative articles, they are not so much used, more in like in Georgia, in Moldova, in Tajikistan, so they are not widely used. In Kyrgyzstan, there is no direct prohibition, but there are articles which are widely used for involvement in prostitution, and we have marked this zone red, and you will hear about it more in my presentation. As for drug use possession with no selling purpose, so there is administrative responsibility here, but the situation in Georgia is rather difficult, and for a number of substances there are no limits limiting quantities and amount of substances which lead to criminal responsibility. So a lot of people who just possess drugs for their personal use, they risk criminal prosecution. About LGBT, the situation here seems to be better. This LGBT behavior is not criminalized, but only in 2 of them, Georgia and Moldova, there are anti-discriminatory laws, but the level of application of such laws is still low and the level of stigma is still high. So that is the challenging environment in which our reactors work since the beginning of this year. So we have already mentioned that currently REACT works in 5 countries, and there will be 2 more. That's the general geographical coverage. And in all the countries, REACT operates not only in the capital city, but in a number of countries. So in Ukraine, it's almost 30 countries. In cities, and like in total, there are about 30 of them. So there are 74 NGOs involved in this project altogether. So that's quite a big program with a lot of actors and with a big geographic coverage. In terms of registration of Kscs, you can see that this process started with different intensity and there were different numbers of actors, for example, in Georgia and in Moldova. So the number of cases reported is around 200. About 150 in Tajikistan, 413 in Kyrgyzstan. Every case was assessed for its significance, and we tried to qualify all the cases and determine those which can be qualified as human rights violations. Here we were looking at fundamental human rights such as the right to health, right to movement, right to proper treatment, adequate treatment, and the lawyers analyzed each case and defined the cases which could be qualified as human rights violations. So you can see that in every country the percentage of such violations is quite high. So as for the partnership, we have our key implementers in each of the countries. That's Georgian Harm Reduction Network in Georgia, which works with 14 NGOs, in Positive Initiative in Moldova, which works with its human rights partners. That's the National Legal Aid Council. In Kyrgyzstan, partnership network interacts with the Soros Kyrgyzstan Foundation within the Street Lawyers Project, and in Tajikistan, Spin Plus works with the Center for Human Rights and with UNDP. And such partnership brought together both organizations which have access to key populations, which work in the field within prevention programs. So they are really close to people whose rights are violated, members of key populations, and providing linkage to the legal aid which can be provided by technical partners. We thought about the future of React and how React will be function in the countries after SOS project is over. But you can see that in some countries we were able to ensure sustainability of this initiative through Global Fund grants. And for example, in Moldova, React was included in the National HIV program for 2021-2025. So we hope that it will continue operating, improving, and it will be a key tool for monitoring human rights violations in this country. Next slide. So on this slide, you can see representation of key populations among the registered clients in different countries. So on the one hand, this information can show certain regulatory environment and the existing situation, but also it demonstrates peculiarities of our implementing partners at the local level and what key populations they work with. So if we have more reported cases by one key population, it does not always mean that it has most unfavorable position in the country. It rather reflects our partner organizations and the key populations they work with. But please pay attention that in Tajikistan, almost half of the violations were reported for people living with HIV. That's a really high percentage, and they are disproportionately affected as compared with other countries. So the next category here is people who inject drugs in Tajikistan. As for Kyrgyzstan, the biggest share of violations, 33%, were reported by sex workers. And we have mentioned already the criminal code of Kyrgyzstan and its application, which in particular lead to the high share of this group on this chart. As for Moldova, they have almost equal shares of people who inject drugs, people living with HIV, and sex workers. In Georgia, the key group is sex workers, but pay attention that in Georgia, our partners were able to reach the group of MSM and work with them. In Central Asia, this is usually a very closed group, so not many cases are registered for this group, which does not mean that such cases are not frequent or they do not exist. So on the next slide, you can see analysis of the perpetrators of human rights violations in different countries. So three biggest categories of perpetrators are government agencies, in particular law enforcement agencies or police. So 260 violations were by police, especially in Kyrgyzstan. Also healthcare facilities, almost 100 violations in Moldova were registered by healthcare workers. So the third category is family or partner of KP members. So about 60 such cases were reported in Georgia. Of course, with such perpetrators, it would be very difficult to reach the 10-10-10 targets which were mentioned by our UNAIDS partner. When government agencies are the key perpetrators, creating legal barriers in access to health services. So now let's go to the next slide, and we will go a little bit deeper into the human rights violations from those biggest perpetrators. First of all, we will talk about the types of human rights violations by law enforcers or police. So in the total number of cases, there are almost 40% of cases committed by those. But in Kyrgyzstan, that was almost half of the cases by law enforcers. So those are such violations as extortion of bribes. That's the biggest one. Also, arbitrary detention and abuse of power and force. So on the next slide, you will see what kind of violations we are talking about. And we can see that the biggest number of cases are about sex workers, people who use drugs. So for sex workers, police officers ask them to provide monetary rewards, so actually money. Also, police can do nothing if cases are reported about violence. In Tajikistan, there are attempts of criminal prosecution for putting people in danger of HIV infection. Also, there is unjustified restriction of movement, especially during lockdown, when there was curfew imposed in our country. And we can see a lot of violations against people who use drugs, and it is very sad that people are detained and when they are leaving the OST substitution therapy sites. Like one person is telling, I was stopped when leaving an OST site. They took me to the police station and they made me clean the premises. They threatened and intimidated me. I was there for over 4 hours, but I'm scared to file a complaint because I'm worried about my life. So what scale up of OST program can we talk about when people are facing not just obstacles, but really intimidation and such big barriers just when they access health services?
Now let's talk about the next group of violators. We'll speak about human rights violations by health professionals. This is the second largest group of violations. 23% of all cases where the perpetrators were health care worker were registered in our countries, and most of all those cases are present in Moldova. 42% people are denied of health services, discriminated due to their HIV status, and their HIV status is disclosed. Also specific for Moldova, there was the lack of access to OST or under prescribing of OST, that is low OST dosage. That's you see it in total almost 60% of all cases of human rights violations. The next slide, please. What violations are those? Yes. Most of all, the most affected people are those who need health care the most, those who are in the regular contact with healthcare facilities, that is, people living with HIV. In all the countries, we see the lack of high quality pre and after test consultation, stigma and discrimination, disclosure of HIV status, and that's a real barrier for people who live with HIV that prevents them, that stops them for seeking medical aid. A similar situation is for people with who use drugs. They lack access to OST, for example, because the site may be too remote from the place where the key population people reside, and sometimes this information about the person being on registered as a drug user is disclosed, and that leads to a stigma of the person. Another example is about a pregnant woman with HIV. She was isolated in the maternity clinic due to her HIV status. She was forbidden from using public toilet. When she was released from that place, her medical records contained indication of her HIV status, and while she was there, she was treated by medical personnel with disrespect. So you understand how bad her situation was in this very critical time for her. Now let's talk about the next group of perpetrators. That's the third biggest group, private individuals. 22% out of all the cases, and the largest part of them was in Georgia, 46%. Here we speak about stigma, offenses, violence by the people who hate LGBT. And in particular, I'd like to speak about the women here who belong to key populations, and they were more often subject to domestic violence. And since the time of lockdown, the number of cases has increased. Some cases were specific to individual countries. In some cases, in Georgia, relatives forced women to do sex work and then took their money. So that's an example from the React. The partner is forcing me to do sex work for many years and beats me and takes the money away. Another example is about the LGBT. The MSM was in the nightclub with their friends. They were wearing extravagant clothes and earrings. Other people in the club didn't like that, and they beat them. The client and his friends called the police, who came soon but did not start an investigation. The next slide. Unfortunately, the rights of key populations are violated by public officials as well. In the total number of violations, it's not too much, just 7%, but it was key for some countries. For example, in Moldova, there are 16% of cases related to this particular source of violation. So it's mostly denial of access to social services, maybe some preferences, something that is linked to belonging to the key population. It may be dismissal from the place of employment because of HIV status or being a part of a key population. The next slide, you see here that we have highlighted as the most affected group, the group of people living with HIV, because even when it's not required by law, there is a practice of demanding a certificate about HIV status. People sometimes are dismissed from their employment if they prove HIV positive. And in Tajikistan, before marriage, you must take an HIV test, and then the marriage registration can be blocked if HIV status is positive. One of the examples seen here is about this situation in Tajikistan. People living with HIV are denied child custody. For example, a grandmother was trying to get a custody of a minor granddaughter, and another case was about HIV status. React allows us to collect data presenting a very diverse picture of violations broken down geographically or broken down by the perpetrators or the victims of human rights violations. So it's both quantitative and qualitative information. But the most important thing is that React allows responding to the violations in particular ways. And the next slide is particularly about the response. Next group of slides is about this, about the response to violations recorded by the React system. And you can respond to a violation right away. Reactors are trained social workers operating in the field. They can provide counseling, tell about the best mechanism for response. They can provide psychological, social, or medical aid to a victim. And in more complex cases, trained lawyers are involved, and the clients are referred to them. Here I'd like to show you this particular pie chart that tells us about the status of cases with the example of Tajikistan, and in particular to the biggest segment, 44%. It's the yellow segment. These are the cases when a client does not wish to defend their rights because they are afraid. And yeah, that's almost half of cases when the response was not actually provided, and that's a very important element that needs to get paid closer attention. The next slide. Also, we see some foci of violations where several cases happen in one place, in one city, or in one healthcare facility. Here is an example of Moldova when there were 5 cases of violations of rights of pregnant women living with HIV in maternity clinics. So having received 5 notices, the organization went to the maternity clinic, offering them to train the personnel of this place and other maternity clinics, and also their initiated an order to protect this, to forbid discrimination in such healthcare facilities. So collecting this data has allowed prompt responding through consultations and legal initiatives. A similar situation is in the town of Arahav. 27 cases were registered because of the limited access to OST, and the fact that the OST clients had to take a 50-kilometer distance to receive the next dose, and it was especially difficult during the lockdown. And the organization called Positive Initiative went to the Ministry of Health asking them to open an OST site in Archiv. So these are very localized but very important situations that are totally the life changers for people. The next slide. React also provides an informational base, an evidence base justifying different activities at the local level, at the national level, to improve the situations with key populations in a systemic way. There are 2 examples from Moldova, and we'll be speaking about them in more detail later, so I will just be very concise about them. There are 4 cases regarding obstacles for adoption or custody of children for people living with HIV. The problems have been resolved by our partner, soon you'll know how, and also labor-related discrimination of people living with HIV. There was a strategic litigation won by the Positive Initiative organization, and it will be reflected later in the national legislation. The next slide. Based on the analysis of the legislation and analysis of appeals to the React system, strategic recommendations have been prepared for every country, and some recommendations are the same for all the countries. It's stop criminalization of the risk of and exposure to HIV infection, and also recommendations on providing trainings to health professionals and police officers on non-discrimination and respectful treatment of people from key populations, but there are specific recommendations for particular countries as well. For example, in Georgia, an emphasis was made on a revisal of drug policies and the size of the doses that entail criminal liability. So that is something that was revised. Yes. So that that could be an administrative punishment. So now, yes, the size of the dose should be increased. The next slide is about Moldova. You see, in addition to the general recommendations about training of health professionals in the police and decriminalization, also there was the point of scaling up the access to OST, especially in small towns. And the organization has shown that this can be changed. The OST can be made more accessible. And in Moldova, it is a part of strategic recommendations. The next slide is for Kyrgyzstan. Special attention is paid to further decriminalization of people who use drugs, and the possibility of using non-punitive measures, including social and medical support, as well as referral from the justice system to organizations providing harm reduction or rehabilitation services. I have spoken on many times about this situation with sex workers and how the police treat them. One of the recommendations here is establishing an overview mechanism to register the cases of violations against sex workers by police officers. So React could become part of this mechanism. In Tajikistan, the next slide, the problem of decriminalization of their HIV exposure is the one of the most important topics. And there are many cases, very sad cases, that actually have affected people's lives and their access to services. Very often they are provoked by the article of the criminal code. So actually, revisal of this article is the number one task for our partners in Tajikistan. And I would like to finish my presentation at this point, and I'd like to say many thanks to the colleagues, our partners, the reactors who have been collecting this evidence, who have worked with it, and I'd like to say thanks to Mikhail Galichenko, who have analyzed these cases perfectly and helped us with reviewing the legislations and so on. Also, thanks very much to Victoria Kolenyuk, who worked on the organization of React in these countries and helped preparing this beautiful presentation. Now, I am really glad that we can switch to the discussion part. And I'd like to give the floor to three colleagues who are Andrei Gunguis from Moldova, Positive Initiative. Yes. Good afternoon. Zyba Kasimova. She's a lawyer on the Center of Human Rights in Tajikistan. Good afternoon. Do you hear us? Say something that we could hear that you hear us. Yeah, sure. Thank you very much. And Irenbek Sadikov from Kyrgyzstan. I'd like to ask a few questions about the way you work with React. The first question is to Andrei. So, Andrei, you have worked a lot on labor legislation. A lot of cases were registered in the area of labor violations, labor-related violations. So, please tell us why this particular field was so important and how React helped with it.
All right. So, actually, our activities and the way we solve the problems in Moldova based on the data we got from React. So we tried to understand the problems and try to resolve them. And one of the systematic issues that we have seen were violations of labor rights of people living with HIV. So we took one case for strategic litigation. It was a case when one of our clients was unlawfully fired due to HIV case. And first, we went to the Council on Equality with this case, and it was important for us to build a precedent and for further response to such cases in the country. So this Council on Equality made a decision saying that a restriction of labor rights is discrimination. So the ground here was health status and it was discrimination. Then we went to the court and we demanded to put this person back on their job and restore all the harms, including material harms. And so our complaint was satisfied. It was just recently in late November. And in December, a national campaign started dedicated to the World AIDS Day. And we were able to showcase this decision and this case throughout this campaign in mass media, and we think it was actually quite a successful case, which can be a precedent helping to change situation in this sphere. And we also work with other systematic issues that we have seen. Some of them have been mentioned by you about maternity clinics and access to substitution treatment, about adoption rights, about adoption after registration of cases. We started actively working in this direction, and the first thing that we did, we started to study the practices of adoption in our region. So what countries are using these practices in what way? So is HIV status a limitation? Does it prevent people from adopting children? And we received written evidence showing that different regions, different countries have different practices. So in some countries it is a barrier to adoption, in others it is not. So we collected all the necessary information and we addressed the Ministry of Health, and within the campaign dedicated to the World AIDS Day, we were able to agree with the Ministry of Health to adopt a resolution which would clearly state that any refusal to adopt children based on HIV status is illegal. And just a week after, we had an agreement from the ministry that such an order or such resolution will be issued. Though in our laws there is no provision saying that HIV status is a barrier to adoption, but the practices in the field are quite various. Thank you a lot, Andrei. This is a very impressive case, and it shows how your professional knowledge and React tool helped to bring the labor rights of people living with HIV and start to addressing them. Zebo, I would like to ask a question to you. So the rights of people living with HIV, the risks of HIV transmission, and Article 125 in the Criminal Code. We know that the Center for Human Rights works a lot on it. So what are your future plans? Can we expect that this legislative provision will be revised? Thank you, Tatiana, for your question. Good afternoon, everyone. So I will introduce myself. So I am a lawyer and an advocate, and I protect the rights of people living with HIV in all government agencies. So I'm the first actually lawyer and probably the only lawyer for people living with HIV. So they come to me, and I can say that they really trust me. So I worked in the Center for Human Rights, and I work in this project to reduce legal barriers in Tajikistan. And the Center for Human Rights have been working on in this area since 2017. And the center did a study on HIV and human rights, and it also showed certain aspects of discrimination in the Tajik laws and discriminatory practices against people living with HIV. Currently, within this project, since actually 2018, we are providing legal services to people living with HIV, so both for civil and criminal cases. So we provide them legal support and assistance. And we also advocate the reform of regulatory framework. And what plan and results do we have now? First, we analyzed the criminal legislation of Tajikistan and Article 125 as for its compliance to the international human rights standards, compared with the international experience of other countries which abolished their provisions on criminal responsibility for HIV transmission. And there was a decision of the Supreme Court on how to apply this article, not to discriminate against people living with the HIV. So we hope that it will be approved. Currently, the working group is working on it. There were numerous meetings of the working group to prepare new criminal code of Tajikistan, and our gender experts made sure that part 1 of Article 125 of the criminal code should be put into the Code of Administrative Offenses. But we are waiting for the new criminal code to be approved, because so far it's difficult to say something for sure, but we are working on it. Also, we have one case based on part 1 of Article 125 about a woman living with HIV, and we want to bring it to the UN Committee on Human Rights. So I have been working for quite a long time on this case, and hopefully we will bring it to this high UN level. Thank you, dear Zebo, for your work on individual cases and within the national legislation level, and even working on those human rights violations. I'm sure that your efforts will lead to good results. So, Olympiak Sadikov, now I would like to talk to you. So, violation of human rights by police, that is what typical for all countries of the region, and it happens also in Kyrgyzstan. We know that the foundation Soros Kyrgyzstan works on it. Could you please share your experience? So what you do, what works well, and what would you recommend others to implement? Good afternoon, dear participants of the conference. I would like to thank you all for quality data, quality presentations, in particular on country indicators. So about the situation in Kyrgyzstan, actually Tatiana briefly presented it and obtained it from React, but I would like to tell how we respond to certain human rights violations, because as we say, most of those violations are committed by law enforcers. So I would like to tell about the approaches that we use in our work and how we respond to those kind of violations. So Soros Foundation, together with the HIV service organizations and human rights organizations, works in two areas, on two components. So the first component is the human rights component. So as Zibo said, that is about using lawyers' services and providing legal assistance, including street lawyers' services to protect the rights of people or restore violated human rights. So both in individual terms and in terms of working with law enforcement agencies to protect certain categories and groups of people. As you know, this approach sometimes works, sometimes it does not, considering that the law enforcement system is actually like the biggest government agency. It is about 14 or 15,000 people, and so responding to all violations from all those law enforcers is really difficult, because it would require a lot of people, a lot of lawyers to respond. So we are also using another a component, such as we call it constructive dialogue. When we go to law enforcers, we go to decision makers, and we talk about our work. So we need to train law enforcers starting from the Academy of the Ministry of Internal Affairs. So this is where the future police officers are educated and trained. So most of police officers come from this academy. So that is our platform where we can provide training to them. So we already have a course on harm reduction and a course on vulnerabilities. So we have been working on it for over 10 years. And we already have a number of trainers who can provide such kind of training. And the second stage is when we work with current police officers, when we train them and we integrate guidance into their daily work. So we have an interagency order of several ministries and agencies on prevention of HIV and on working with the key and vulnerable populations. This guidance actually is quite progressive, but the question will be how this guidance is implemented at the local level. So when we do monitoring, we see that there is a high turnover of police officers in law enforcement agencies. So, and every year we do this kind of training and we see new people every year. So we understand that we need to continue this work on an ongoing basis. We cannot just do this kind of training and workshop once. We need to repeat it on an annual basis. And it gives certain results. Those results are still fragmented. And I saw these numbers from React. And actually the situation in the country is quite fragmented. So in one city, there can be a lot of human rights violations by police. However, at another city, NGOs maybe have signed already memoranda with the law enforcers, with the health sector, and already there is certain cooperation and there are fewer violations as a result. So when we talk about violations, we usually try to talk about specific cities, like in Osh and in Bishkek. The situation is what you showed, like in React. But there are other cities such as Karakol, Karakbalta, and the work of NGOs and work of law enforcers. It is based on cooperation. So people already agreed that together they will make efforts to improve HIV services. At the same time, I would like to say that all the gaps and successes, they are also linked to time. So it depends on the people who currently take this or that position and what kind of impact they have in geopolitical terms. You know that as soon as there are some measures in Russia to close HIV programs or prevention programs, it also comes to our country and it is reflected in our situation. So it starts this kind of turbulence.
So thank you very much for this beautiful experience, for sharing the information about the approaches that actually work, and that is something that can be used by other countries of the project as well, not just the countries of the project. Thank you very much, and thanks a lot to Andrei. Thanks, Zebo, dear colleagues. They stay with us until the end of the meeting, so if you have any questions to them or to us, you can write to us. Also with us we have React implementers from Georgia. You can ask them your questions in the chat or during the last session of the event. Now we're switching to Ukraine again. Thank you very much, Tatiana, for this interesting large-scale presentation of the situation in the region in the 4 countries of the EECA region. And I'd like to say a lot of thanks to Andrei Zebo and Ilimbek for the situation, about the situation in the country. And if you do have questions to Tatiana or our regional partners, please do not hesitate to ask them in the comments under our broadcast, either on Facebook or YouTube. We will ask them during the Q&A session in the end of the event. But it's not the end yet, and we have been just talking about the regional aspect of human rights violations with regard to key populations problems. We are talking about that on the eve of the Human Rights Day that will be celebrated all around the world tomorrow. And now we are going to talk about the situation in Ukraine, where also during 1 year the REC system has been implemented, and we see some information about the pilot regions, and we already see some trends. It has been done, and the recommendations have been prepared to present the situation with the implementation of the React system in Ukraine for the first year. And so I'd like to give the floor to Mikhail Holichenko, international expert on human rights and senior analytic of the Canadian Human Rights Network on HIV and AIDS. He will be speaking about the implementation of React in Ukraine, main results, and the ways for responding to human rights violations. Thank you very much, Mikhail. We understand that it is difficult for you to connect to us because of time difference. Nevertheless, thank you very much. Thank you, Maxim. Thank you, dear colleagues. Now let us talk about Ukraine. Of course, the results of React are quite impressive. So let me make a small disclaimer at the very beginning. I am here as an independent expert, and on Ukraine, I've been working as a participant of the technical assistant under the GF program on overcoming legal barriers. So my participation in preparation of this presentation and the React work is not included in what we call technical assistance. So I have two different roles, and React is a separate thing that's between me and the alliance. Now, talking about the results of work in Ukraine, I'd like to see the slide so that I could see it. Yes, thank you very much. And right away to the next slide. Ukraine has been showing the most impressive results compared to other countries because of different reasons, and in particular, you see the beginning of the work, and throughout the first year, the operations have been conducted in 4 cities, and yet we can say that Ukraine has been showing that React can be implemented at the national level in this national scale, and you see that it was not just the cases in 4 main cities, but also cases recorded from other regions, other oblasts, and that shows that React is moving in the right direction, and in future hopefully all the regions will be covered, because of course violations happen not just in 4 cities. In this year 775 cases have been registered, and you see there are examples when there can be several cases of one client. That is a very correct approach, like they have less clients, more cases. So it is all centered around the person, and we know that every person from key populations has usually the experience of several violations affecting their access to healthcare. And React just notices that in Ukraine we have 760 program clients and 775 registered cases. In the 4 cities and nationally, partner NGOs play their part. They are 28, and they are not just sources of information about the incidents, but just the bridges between React and the key populations, but also other organizations that are used for referrals. And soon you'll see that Ukraine has good results because React works really well, not just for collecting evidence of violations and analyzing them, but also providing response. This ACT component is very good in Ukraine, and it all happens thanks to the 28 partner NGOs. React has been operating for 12 months, and it shows that you can actually deploy it really fast and reach a good project capacity within the first year. So that's also good, showing that the system is of a high quality. Now, talking about the cases, you see in the bottom of your screen the distribution of the cases where they come from. I'd like to point out that one of the main sources is 21%. It's a hotline on OST. And an important component also, I need to emphasize this capacity of React that is so well shown in Ukraine, and there is still room for improvement, of course, is that React should not be the only system for recording and responding. It's just an opportunity to coordinate general activities and keeping the existing systems working, but also encouraging unified approach and opportunity to submit the cases to the one system, accumulate it and then all together move toward the constructive dialogue with state. That's what has been mentioned before. So this example with the hotlines shows that this actually works, both for hotline that can record the new cases through this additional database, and for React, which shows that a constructive dialogue interaction with other systems for recording and responding provides this opportunity. And I hope that all the other systems existing in Ukraine, for example, sex workers are very active with documenting cases of human rights violations. They will eventually be a part of this coordination system supported by the React, and there will be even more active, correctly registered cases. Also, mutual enrichment of the work is the cornerstone of the system, and I hope that it will remain such for React. The next slide. And now, with regard to what groups are present in most cases registered by the React in the first year of the work. So we see, on the one hand, the most active groups participating in documenting and recording, but also we see the groups that are most affected by human rights violations. People who live with HIV, more than 26%. People who inject drugs, that's more than 45%. Men having sex with men, 10%. And there are just 3.5% of sex workers. We know that they are much more numerous and their rights are violated very often, especially by the police officers. But the fact that there are a few cases registered, it just shows that there is room for improvement, and in particular with regard to interaction of other recording system in Ukraine. I think it's the next step of this diplomacy of civil society and establishing cooperation with each other. And I'd like also to point to this part that is shown here in yellow. It's the capacity of establishing such level of sensitivity in React that provides you with an opportunity to break down a group even in deeper detail. So, for example, look at this 1%. You can see who that is. Gender queer, like people who do not belong to a particular gender, or transgender people, or Roma people. So those are the people who you could register as people living with HIV, and this React shows you that this is additional category that will open you a way for advocating, because like you can advocate for the rights of people who use drugs, but within this category you can find subcategories who are even more vulnerable because they are a part of this additional subgroup. So that's a very important component, and React shows that very well. The next slide, we're talking about the characteristics of violations in general first. Then we'll be speaking about two particular examples, and then we'll discuss categories of people whose rights were violated. Now we are talking about the general numbers. You see, like in other countries, that the main perpetrators are medical workers and law enforcement officers. Other public authorities too, but it is health professionals and police officers who are the biggest targets for advocacy. And now already we see those points that require the biggest focus of advocacy, the training, and the attempts to overcome legal barriers, something that needs to be targeted. On the other hand, we need to say that these violations that have been registered, they show that the groups, NGOs, they already understand, they know that they are ready and willing to record the violations of key populations by public officials, because they have good information and understanding of the situation with human rights. And that also proves that when React comes to a well-prepared place in a country, that may give a certain bias at the beginning to some particular types of violations, which will not be an objective picture later. So in future years, we need to pay attention to this and see whether the same ratio will be preserved of health professionals and the policemen, or maybe it will change because React will shift to another more sensitive area such as sex workers, or maybe not. And then we will just continue advocacy for two big groups, police officers and health professionals. React allows identifying within the state's commitments three main types. So when we speak about human rights, the government must respect those rights, protect them, and keep them up. So React allows you to show which particular part of a commitment is not done properly by the government. You see that in the top right corner about the types of violations of particular commitments, and you see that the cases when the government itself is the perpetrator are dominating compared to the other cases.
So usually it means that the government does not respect human rights, actively doing something about key KP members. For example, police arresting a person without proper grounds. That's a direct violation. Or, for example, during the lockdown, if a person detains a person living with HIV without providing them access to antiretroviral treatment, so there will be two types of violations here, but the main one is a failure to meet the obligations and commitments. It allows to analyze compliance of the government with its commitments based on different categories of human rights violations. Next slide, please. So as for the key categories of violations, so if we keep in mind the key categories of violations in terms of perpetrators, now we can talk about the specific violations. So refusal to provide services, that's the main category, but also a worrying trend is violence. So 25% is combined cases of emotional and physical violence. Often it is difficult to differentiate here. It's good that here we have the division by emotional and physical violence, but often they are interrelated. And the fact that there are a lot of cases of violence tells us that we have to improve situation in the country, and it is good that React helps us to register those cases. Also, we can see the general number of stigma and discrimination cases. So here we're talking about stigma and discrimination from the side of police, healthcare institutions, also individuals, like relatives and friends. So we have a high number of stigma and discrimination cases, and it shows that there should be activities aimed at destigmatization in the society. If we talk about the specific key population, so as we remember, the biggest group was people who use drugs, and for those people, there were the biggest number of violations reported, 476. So what were the violations and who were the perpetrators based on React data? So first, about perpetrators. So you see the chart pie on the left. So over 51% of violations were committed by health workers, and here we mostly talk about opioid substitution treatment. And also here we see police when we're talking about arbitrary detention, arrests, and also police officers hindering access of people to health services, such as antiretroviral treatment, for example. There are also other government institutions, such as social services. And also here we have private persons. Here we can see that those are family members and inner circle and the others such as such. Private entities, private service providers, maybe employers, and there are unknown perpetrators. For example, when key population members are intimidated or similar cases. So why do we have to show perpetrators by key populations? It shows us where we need to focus our advocacy activities. And you will see our recommendations, and the recommendations are based on the registered cases. So in real time, we see what happens with representatives of this or that key population, and we can revise and update our measures and see how the situation changes from React data. And as for the types of violations, here we can kind of compare those diagrams. So the main perpetrators are health workers, and the biggest category of violations is refusal to provide services. So we understand that it's about health services. And we have that physical violence and emotional violence together equals about 24%. But here that's mostly about police. Also, we can look who are the main perpetrators and what are the main violations. So stigma and discrimination, also we understand which sector it comes from, although it can happen in terms of different perpetrators, but it can happen from the side of family members, police and health workers. So we can make this kind of comparison here and have a good data-based analysis with the relevant response measures developed. So see here I'm talking about systematic analysis, not about individual cases, because as for the individual cases, we will see the next slide. So the next slide is also for people who use drugs. And here we are talking about specific perpetrators. So it also shows how React shows us can work if we are interested in a certain perpetrator. So what kind of cases we have registered here? Like in Ukraine, for example, police often takes part in different trainings, workshops. In the police academy, there are courses for human rights and advanced training courses on human rights. However, we still have this type of violations by police. So most of those cases are the actions during the intake period. So first several hours when police starts interacting with the KP member. So often it means illegal personal search. It often happens on the street when a person is stopped and there is an illegal search without proper grounds. Also here we are talking about arbitrary detention, with the humiliation, with the abuse, verbal abuse. So it all can happen in the context of initial interaction with the KP member. And also abuse of physical force when a person is trying to respond, trying to protect their right, and the police responds with a physical force, which is often also unjustified. But with the stigma and discrimination, the police officer can justify such actions to themselves. So that is why they decide to abuse physical force. So we see that there were 93 cases of physical violence reported during this initial intake period. So it clearly shows us where we need to focus our further advocacy activities. So I will not comment on the whole slide right now because we are running out of time, but this slide clearly shows how React data can work if we talk about a specific type of perpetrator. Next slide, please. So here we are talking again about violations against people who inject drugs with the engagement of the next perpetrator, state health workers. So also here we have different types of violations, show in what context the violations happened, and divided by separate health services. So we can see that the key violations were related to OST services, and in the context of OST, we have violations related to reducing the dosage, refusal to provide take-home doses, and some other types of services. That is also an important feature of React to respond to specific violations. Next slide is about violations reported by sex workers. So why did we take sex workers here? It was to show that on the one hand, React allowed to show data on for people who inject drugs. However, activities should be improved for sex workers. For example, only 37 cases were reported by sex workers, because you understand that 37 violations, that's not a lot. And for the next period, we need to talk to organizations and initiative groups, and we need to build better contact with them and engage with the sex workers to have a more constructive dialogue on using their data, because sex workers have their own tools to respond to violations, but in React, there were only 37 cases reported, though the number should have been more. The next slide is an important component of a React operation. Can we go to the next slide, please? So in the context of coronavirus, of course, it is too early to draw conclusions, of course, so those numbers might not be representative, but still there are quite a lot of cases, and if we look at the quality of documenting these cases, the quality is quite high. It is probably related to the case that coronavirus and all things related to it happened at the point when React was already rolled out to its full capacity in most cities. So the quality of data here is quite high, and the cases registered and related to COVID, they clearly show how stigma and discrimination faced by key populations strengthened in the context of the COVID pandemic. So people are facing the same stigma and discrimination, but which is even more justified. So in terms of violations by health workers and police who say that, well, we have this coronavirus pandemic and they can refuse a provision of health services, they can demonstrate stigma and discrimination and verbal abuse. I think that we will see even more cases of this type in the nearest months. So far, maybe not all cases have been reported. The next slide is about how React responds to a violation. So the ACT component First of all, here we talk about the possibility to provide primary legal aid and refer people both to receive secondary legal aid from professional lawyers and psychosocial support. The important part here is to understand that primary legal aid here does not mean some like low quality or unqualified aid. No, if we look at the division, next slide, we can see that those primary legal aid services, they include representation of the client's interest, consultations, response at quite a professional level to violations, but referral to secondary aid, that's just more a conditional division when it is necessary to include a professional lawyer.
But primary aid, primary legal aid does not mean for certain that it is something negligible. React in this part, I think, has worked really well, also considering it's the first year of work. The number of cases where people got support, more than 1,000 of them, just proves that React is working properly. The next slide. Now we are getting to the recommendations. The main conclusion, and that's the next slide, is about the fact that React, even now, after the first year, shows that, Ola Varetska did presentation about what React was intended to do, how it had to affect the situation. I will tell you about the actual situation, how it has worked. The first thing is evidence, an opportunity to build verifiable, reliable evidence to raise the level of information within the dialogue with the authorities based on increasingly stronger feedback from beneficiaries. So we keep working with the government, and the public authorities receive the real-time feedback from the beneficiaries of the services, and that concerns the barriers and the way the public officials treat such people or work with them. So an evidence-based advocacy is what React is actually capable of supporting. And I, even in the Russian language presentation, I left the word empowerment in the English word, because it is exactly this empowerment through improved documenting. The role of the civil society gets stronger. And we keep hearing from key populations that evidence collection projects, okay, we have recorded another thing, and then a report is created. What happens next? Now, React shows, on the one hand, the capacity to respond to documented cases by providing the first support and referring people, but on the other hand, shows the results in the dialogue with the government, and it makes key populations truly believe that participation in React is more important than another short-term documenting project. Next point is strengthening meaningful dialogue between key populations and authorities based on collected evidence. So now key populations are not just some individual submit individual claims about some violations, but they can use a database of evidence where there is an increasingly more and more information in order to keep up ongoing dialogue on human rights violations, about how we should act to remove those factors causing such violations. Next point is the adjusting of the work on individual cascade components based on identified systemic barriers. So we can look at the groups of perpetrators, groups of victims of violations. yeah, we can do something about that from the things that create barriers to accessing testing, or maybe further treatment, like when a person is detained by the police and cannot obtain services. And the final thing is impact assessment, and that's something that is not being done in our countries. For example, a law is planned to be adopted, and impact assessment is a part of legislative activities. And before the law is effective, impact assessment after the law is effected. In our countries, we don't have this yet, but React could be a part of this effort, because you can get information about how a specific policy or law works real time in a specific city for a specific key population in collaboration with a particular public authority. The next slide is about recommendations. Recommendations for the civil society. I hope you will give me 1 more minute, because I have 1 more slide. I'd like to combine those recommendations into 2 groups. First is about raising awareness of health professionals and public officials, and second is raising awareness of the key populations. React now at least shows that we need to focus on what we call routine training, routine teaching, or awareness raising. So like NGOs should not rest on laurels saying like, we've conducted 25 trainings, that's all. And actually that is correct. Yes, we need to keep retraining new police officers and health professionals. And if we speak about general population, they also need to be taught and educated if we want to reduce stigma and discrimination. And without additional involvement of CSOs, we cannot do it. And key populations themselves, they must understand that and know what needs to be done. And the final slide is about the recommendations for authorities. I'd like here to refer people to the EECA's recommendations on decriminalization in particular, and they have it as a particular point about Article 309 about the so-called anti-discriminatory legislation, especially on SOGI basis, on how we can improve the application of Article 161 of the Criminal Code of Ukraine, decriminalization of HIV infection, decriminalization of sex work, and the next recommendation is about involving representatives of the Ombudsman and Prosecutor's Office in working on reports on cases of extortion of bribes. Thank you. Thank you very much, Mikhail. Thank you very much for this comprehensive presentation and this report on the results of the first work of the React in Ukraine, and the conclusions that can be made. And I'm not saying goodbye to Mikhail yet, because we are still going to have a Q&A session. Dear colleagues, dear audience, please leave your questions that you would like to ask Mikhail or other participants of today's event in the comments to our broadcasts on Facebook and YouTube. And I'd like to remind you that the presentations that we saw, the first reports on the results of work of React system in the region of Eastern Europe and Central Asia, you will be able to find both in the real time on the new site react-aph.org. You can see that in the bottom of the screen, and we've heard the results about the presentation. In general, we were listening about the overall aggregated figures and references to particular typical human rights violations. Now, the next session is going to be about a different aspect of it. We are going to talk to our colleagues who have been able to enable the existence of the system itself, the reactors, I mean, and they are the first people who get the complaints from key populations. They enter the data, the cases into the database, and they know from the first hand the situation with the key populations in Ukraine and in the region. So for the first discussion, I am inviting 3 reactors from Ukraine: Albina Kotovich, who is the head of the NGO Sun Circle from Odessa, Boris Zolochenko, head of the regional department of Gay Alliance of Ukraine from Kryvyi Rih, and Yulia Kogan, regional coordinator of the charitable union of Volna in Odessa Oblast from Odessa. Now, dear colleagues, please join the discussion, and thank you very much for finding the time to work with us. As you see, I'm looking at the phone because this is where I receive the questions from our viewers, from the audience. Albina, let us talk to you first. Good afternoon. Yes, good afternoon. Thank you very much for joining us. You and your colleagues know very well about the situation of people living with HIV in your region and how it goes with the violations of the human rights of this key and a very important population. So what type of violations of human rights are most common for people living with HIV, and what are the consequences of those, including in the terms of access to prevention and treatment? What is your experience? Well, mostly we noted complaints from HIV positive women about from various categories, and that included women of fertile age, pregnant women, mothers with children, and women in detention, or those who are former convicts and who encountered violations in the society after they were released from prison, and the women of more mature age, at the age of menopause, and receiving certain specific services, with concerning their age specifics. It's just not available to them at the moment. The situation has been aggravated by the lockdown, and the lockdown activities affect both the healthcare system because the access is so much more difficult, and there is also the lack of access to all the needed services, low level of access of free of charge services, and even the state guaranteed packages when woman gets to maternity clinics for labors. We've seen the cases when women were the object of bribe extortion, but we documented those cases and dealt with them individually on an individual basis. Yet this is a systemic violation, and it probably requires more attention from the authorities, from the health care facilities and their management. And another thing that we can note is something general for HIV, common thing for HIV positive people, and this region and Ukraine in general. That's the access to high quality ARV V therapy. So the number of schemes is limited, and many people either drop out from the program or refuse to take it because they get side effects, adverse effects related to some drugs which make their quality of life incompatible with the living. And the treatment regimens are usually not individual, not custom made for every particular patient, to our great regret. And in some cases, in cases of late discovery and a very quick prescription scheme without this preparatory stage that we used to have when prescribing ART, very often people die. That just leads to them dying.
Of course, it is very difficult to record such cases. I like to find someone to blame or to really make the person write a complaint. I'm sorry. But however, we have some complaints with the specific names in our region, and we refer them to the advisor of our Minister of Health to make this information accessible to high-level decision makers, so that all together we could somehow change this situation in Ukraine. Because it is a very sad practice, unfortunately, and if the quality of life of people living with HIV is not the highest priority, as well as HIV detection and diagnosis, unfortunately, we will see aggravation, serious aggravation of the situation. And the quality of right is actually a right of a person, a human right. So without the ability to implement this human right, this lack of ability is actually a very serious structural and institutional violation. And it's not just in one of the provinces or oblasts, it is a situation in Ukraine as a whole. So I think that this is a burning issue which should be a focus for decision makers and all our partners to change the situation together with civil society. Thank you, Albina. This is really a human rights issue, and that is why we are talking about it on the eve of the Human Rights Day. So human rights violation is a very unpleasant topic, but still a key topic for us to change the situation that we will have tomorrow. That's why we implement React. So you have been working with the system for quite some time already. So has this system somehow influenced your work, your support programs? So did it help you or not? But could you please be brief, because we have limited time. It really helps us because we record violations, and in every individual case we are looking for mechanisms to resolve a situation of a specific person. And in this way we can see the trends that we have, the strategies that we need to pay attention to, like what services we need to develop, what areas we need to develop in the region, what systems require more control maybe, what kind of control or oversight it can be. So what should be the methods that we need to use? And it really helps us to understand their realities, our today realities among our clients, and the new challenges that we can face in the future to prevent them. Thank you. So we will try together with you to develop React, to improve it. This is what we are doing actually now. You know it from our work in communication as well. So thank you, Albina, for joining us. And now I would like to invite Boris Zalotchenko, our colleague from Kryvyi Rih, Ukraine. Boris, so if you look at the first data we received from React system for Ukraine, we will see that for such key population as MSM, people who seek help or seek some services, they often specify different violations, different perpetrators. There are much more frequent cases of physical abuse and lack of protection from law enforcement agencies in particular. So that's the data we received from 4 pilot cities. So from your experience, could you tell us what kind of human rights violations representatives of this key population most often face? And who are the actors, the institutes, which are perpetrators? So, Boris, the floor is yours. Good afternoon. Unfortunately, recently, we have seen traditionalist groups being more active. Those are hate groups, radical groups, which have very bad attitude to LGBT people. And recently they organized so-called safari when there is an MSM, a gay man. He meets someone in the internet, and this is a fake person on the internet. But when he comes to the venue where they agreed to meet, there is a group of, physically strong men who beat him, humiliate him, or make some humiliating videos, which they later post on the internet. And this is a big problem now for LGBT community, and specifically MSM people, because they are the ones who find themselves in such circumstances most often. Unfortunately, police does not want to respond to such cases. They often reject such cases, say that they would not investigate them. They say that they do not know who perpetrators are, and they find all kinds of reasons to reject those cases. And even the complaints which are filed, they're not investigated, and after a while they're just closed, because the police just doesn't want to work on those cases, doesn't want to investigate them. And could you tell me, because one of the another peculiarities of human rights violations for MSM and LGBTQI communities is that very often perpetrators or offenders are people from the inner circle, especially if we talk about young people, adolescents, or people who are, still young adults. And this shows that discrimination and homophobic discrimination and stigmatization of LGBTQI communities are still widespread despite all the progress that we've seen. So in terms of the physical violence that you have mentioned and the other manifestations, so do you have a vision of what needs to be changed in future to reduce the number of such cases? What is the problem? Is something wrong with our regulatory framework, or with informing, or what is the cause of the situation? I think that speaking about such cases when teenage LGBT people are made to leave their homes or they are prohibited to spend time with their peers, it is just important to explain to parents that a gay son, a gay young man is not a catastrophe, is not a tragedy. So most often when they come to our organization, parents, they come to us, they receive adequate information, and in those families we see that relations are improving, the situation is improving, and such a child or teenager just lives in a normal family without discrimination from his own family members. So I think that it would be important not just, to print some brochures, but it should be done at the national level. Maybe there could be some kind of awareness-raising programs on TV. There should be more awareness-raising activities, because mostly those are people who are 30 something or 40 something years old. They are still from the Soviet times, and we need to initiate informational campaigns targeted at those people through the channels of communication that exist. Maybe our politicians and policymakers could talk more about it. Maybe there should be some anti-discriminatory laws adopted which would bring the situation to a new level. Thanks a lot, Boris. So, in your words, from your experience, I see that you repeat some of the conclusions and recommendations of Mikhail Galichenko that he presented in his presentation. So he also talked about the recommendations of the Committee on Economic, Social and Cultural Rights. He also talked about making changes in Article 161 of the Criminal Code of Ukraine on hate crimes, where there are no grounds of sexual orientation and gender identity, which should be added. And also there is a question of law enforcement practices in terms of the government actions. So thank you, Boris, for joining us. And now I would like to talk to Yulia Kogan. Yulia, I have a question to you. First, the questions that I already asked to your colleagues before. So what human rights violations do you see most often among people who use drugs, and who are the most frequent perpetrators? So, Yulia, thank you. Good afternoon. So I'm a community leader of the community of people who use drugs. And for me, it is easy to see human rights violations because I am in the heart of my community. And all the guys, they contact me all the time and we meet often. So I work with people who use drugs both in jail and outside the penitentiary system. And I have seen that most often violations are from the side of the police and healthcare workers. So those are most frequent perpetrators. Speaking more specifically, if we take places of detention and prisons, so starting from April, they stopped making tests for CD4 count, and we have a lot of submissions now considering ARVs, lack of the necessary treatment regimens, lack of ability to see a doctor. So those are all the reported cases. And there are violations faced by people in pre-detention, pre-trial detention centers. If people getting such centers, they are detained, and people are just they cannot continue their participation in the OST program. And sometimes, like I have a case now, and there is just no doctor who could confirm that a person is in need of substitution treatment. It seems evident, but there is no possibility to prove this need. And also in terms of detention, there are no cases when people would be detained, and if this person feels withdrawals and abstinence syndrome, he would just be provided with relevant services, substitution treatment, some detoxification. It is just not being done. If we talk about people outside of prison facilities, most submissions are about stigma from the side of health workers.
If they see that it's a drug dependent person, they refuse even sending an ambulance over, and admission to the hospital is also prohibited. No surgeries are performed, and there is a fresh case when a person was living their last hours, and if I didn't go to our working group under the city council, and the press secretary responded. She actually helped me to get this person admitted to a hospital to get the surgery, and such violations are typical for our key population. And the same goes for OST. A lot of cases. I had a huge pack of complaints from people from the town of Chernomorsk. They used to have an OST site there for 200 people, and one day it was closed. Now only 20 of them are still alive. And of course they need OST, but I tried to somehow break through this wall, through this problem, unfortunately to no avail. And the current mayor, as long as he is there, they tell me don't even try, it won't work. But it's a violation of the rights to have access to healthcare services. And I know a lot of cases like this where it's not like individual cases, but several at once. And for example, there was a person who asked for OST in Chernomorsk, and I helped him to get OST in Odessa, but in just a couple of months he again wrote to me because a doctor simply kicked him out of the site. It's a very complicated case because it's very difficult to reach to the truth. I don't know what's happened. He just went off the radars, and he's probably using street drugs, and it's really a bad situation. And so a lot of complaints about OST, and even people cannot start OST because they are not registered in Odessa city. So that's just silly, and it really is a barrier for our work. We lose people when we try to make a reference from their home NGO to a site for them to join the program to stop using street drugs, but the doctors don't want to accept that, and they stigmatize our key population so much. Thank you very much, Julia. Of course, if we can say you described a very sad picture, and your experience resounds with the overall information we get from all around Ukraine. Most often they mention police officers and health professionals as perpetrators, and there are systemic problems where the service provision is linked to the registration of residents. The problems are with access to health care, including the OST do have some hope that it will improve, or can React help? You don't need to say yes, of course, immediately, but the fact itself that we speak about that in the regional level, on the national level, makes me hopeful. Let me be honest. If I didn't believe that you collect evidence and advocate using this evidence, making them visible, and produce some help to the people, I would probably not work with React. I have huge hope that my work will lead to a change in the legislation, to some regulations that will help people. I have high hopes, really. So that's something that we all hope for. Thank you very much for joining us today and for cooperating on the React system in Ukraine. Now let us ask about other countries of the region where React is implemented. Let's ask our colleagues from those countries, and let me start with our colleague from who we already saw today when we had a discussion that Zebo Kasimov, a human rights activist from Tajikistan, a legal expert, a gender expert, and probably the only lawyer going to court with people who are HIV positive. She represents the Center for Human Rights. Hello, Zebo. Hello. Yes. So people with HIV come to you whenever their rights are violated, and you try to help them, if necessary, at court. And as far as I know, it was thought that one of such people who come to you would be with you, a client of yours. So could she maybe... Yeah, to avoid complications, she decided to keep her anonymity, but she still has agreed to tell about her problem with which she came to the Human Rights Center. So I'd like to talk to her. Yes, thank you for coming to us. Yes, we do hear you. Tell us, please, about what problem has led to you to Zebo. My problem that led me to Zebo, when I was working at a salon, I already knew about my status, and I knew that in this beauty salon you cannot work with an HIV positive status, but I have 2 children, and I decided to not disclose my status and continue working, because I had to feed the children. They were small. I had nowhere to go because I was a university student. I did not graduate, didn't have a diploma, so my husband had another woman, and he left me, and then he thought about coming back, and when the other woman learned that he was going to come back, she hired a lawyer, and that woman came to my beauty salon and told my employer about my status, about me being HIV positive. We were in good relations with my employer, but she was forced to ask me to leave the work. Yes, so I did that almost voluntarily, yes, but I had nowhere to go. It was really a bad situation for me, and I went to Zebo. And this woman disclosed the status via internet, via Facebook. 2 years passed. I went abroad to earn some money. Then I returned, and then I was called by a person who told me that they write a lot of different things about you on Facebook, and she was saying they don't mention your name, but they say, like, this girl used to work in the beauty salon and her HIV status was disclosed, then she left, and this woman published information about you. Yeah, my story. And then together with Takhmina, we went to Zebo, and I wrote an application, and we went to litigate to try to get some compensation for status disclosure. Yeah, the court made a ruling 2 years ago, and so she paid compensation for that, and promised not to disclose the status anymore. She even wanted to look for some employment for me. Yes, because she lost her job because of that, and she's in bad relations with her husband. But now it's getting better. The children are growing older. It's better now. I work already. But anyway, psychologically, that's a huge stress. And I see she still have it. Yeah, and I got some diseases because of that. And I'm not in the age to have such a terrible problems with blood pressure. Yet it seems okay right now. Thank you very much, Sebo, for helping me so much, for winning that case. And I would like to say that there are women like me, and I have a problem with the family like this, but I was helped. And even in small villages, they have such people, and no one knows about them. We live in the city, and they just don't know about that. They are afraid to seek legal aid because they're afraid of status disclosure. Because yes, when I learned about my status, I thought that was the end of the world, the end of the life. But bit by bit, I got myself together, and then I was promised that it would not be disclosed. But then, yes, nevertheless, there is this bad feeling about it. Yes, thank you very much for sharing your story, and thank you very much for coming to Zebo, and thanks, Zebo, for helping this woman. Always happy to help, yes. Unfortunately, such success stories don't happen as often as we would like. But tell me, Zebo, that feeling that everything is over when the person learns about being HIV positive, and then about disclosure, loss of employment, loss of contact with the family, with your closest circle. How typical is that for women who live with HIV, and how common is status disclosure in Tajikistan? Because I understand that even now you have some cases like that. Yeah, at the moment I have a very complicated case. We know that women are much more vulnerable than men, and this problem is now acute all around the world. Not all the people think that a woman living with HIV is more subjected to violence than a usual person, and our women, even that they are afraid to seek legal aid because they are afraid of status disclosure or being misunderstood, and it's difficult to provide services to HIV positive women in cases of domestic violence because of lack of awareness of the society about the problem. Now I have such a case when a woman has HIV status, and her child too, and her husband does more than domestic violence. He actually tortures them because he forces her to sexual contacts in front of children. So that's a physical violence, and murder threats. So it's like not 24, it's 25 5 hours a day. I support this hotline because that domestic violence is especially happening in the evenings, in the night, and she calls me, she cries, and we try to support her through hotline, telling her where to go, how to complain. But she's an Uzbek. She doesn't speak Russian or Tajik languages, so we have to take her to court. I hope one day it will happen, as according to the constitution of our country, every person can have the right for legal protection of personal life. And the husband of this woman came in the street and started shouting, "You have AIDS and your son has AIDS, you will all die." And even he dug a well and said, "I will kill you and your son, and then will drop you there, and no one will find you." And women with HIV more often encounter domestic violence after status disclosure. And she said that after her husband learned that she and her child had the status, he started being really violent.
So that is the situation, which is not very good. And I hope we will win this case as well. Yeah, the situation is really terrible. And what you say, it is typical not only for employers in the labor sphere, but even for the closest people. Yes, right. So now you are a coordinator of React in Tajikistan. So does React help you in any way in your work? So you have been using it just starting from recently. So are there any changes? Thank you for your question. It helps because it is very easy to document cases in React. It is a very convenient database because in our center we also have a database, but it is more simple. And in React, it is very convenient. It is very well developed. And we have 7 NGOs engaged, and reactors work in all regions of Tajikistan. Reactors are very active, though they are not lawyers, but they attended human rights trainings, and they on their own can draft a complaint, draft a report to police. So they can accompany and support a person seeking legal and social help. If those are more complicated cases, like about criminal cases, for example, they refer those people to us, to the Center for Human Rights. So after we had React, we developed our cooperation with NGOs, and reactors refer complicated cases to us. That's how it works. So that's quite optimistic and quite positive picture that we see in terms of React and Ukraine using React. So thank you for your work. Thank you to your client for joining us. And we have just a little time to talk about situation in another country, in Georgia. So with us, we have Archil Rekhviashvili. He is a reactor and he works in Georgian organization Tanat Goma. So good afternoon, Archil. Okay, so Archil, good afternoon. Good afternoon. So we already have some general data for Georgia, which were entered into the React system, and this data was presented by our colleague Tatiana Deshka in her presentation. So in Georgia, we saw the biggest share of reported cases from sex workers, and our colleague Mikhail Galichenko, when he analyzed the cases in Ukraine, he said that there was not a very good contact with the ski population of sex workers. And in Georgia, I think that there is a better contact with this population. Yes, so could you say that your organization has a regular contact with sex workers? Yes, we do. For about 20 years, we have been working with this group. And that is why probably we have more reported cases for this key population. So are there more violations of human rights? Well, I cannot say for sure that there are more violations of sex workers' rights than in Ukraine or in some other country, but we have been working with the ski population for 20 years already. So we are in permanent contact with them, so that's probably why they report the violations to us. I cannot say for sure that something is happening here which is not happening in other countries. And establishing and maintaining contact with the key population. We know from our experience in other countries that it is very important. Yes, it is. And trust, this is something that you do not build overnight. You need time for it. Yes, right. And for the violations registered in Georgia, there is a type of violation mentioned by our colleague, which is not mentioned in our country, in other countries. When sex workers are forced to engage in sex work by their family members or other people from their inner circle. So why do people actually do it? And are those just single cases or are they numerous? You know, sometimes it can be in direct sense or in indirect sense about this forced engagement in sex work. Because sometimes in the family, a woman is the only person who makes money. So her relatives can sometimes kind of encourage her to engage in sex work so that she can support her family, you mean? Are we talking about some poor families here? Yes, just to make some money for their living. And it happens quite often, not only in Georgia, but also in other countries. In the families, sometimes only those women bring money to the families, and they actually, you know, are the breadwinners in those families, the only ones. So that's an example of how human rights violations are linked with poverty and low income, which are quite typical for our countries. Yes, that is a real problem and it affects the situation, of course. And so the fact that people report those cases to you, that's because of the trust that you built, right? Yes, we have built those trust with them. And now you are putting this information into React. So did something changed since you started working with React, or do you expect any changes? You know, now I can say one thing for sure, because people come to me and they are talking to me about some problems, but very rarely, almost never, they go to police, almost never they go to court, etc. So far, it almost doesn't happen. Why? Mainly because they are afraid, they don't believe that they will receive protection. Yes, they are afraid, they do not believe that something good will happen. Like I had a case, for example, when a woman came and said that she was raped. And I told her, you need to go to court, you need to go to police. And she said that, well, yeah, but I am not a virgin, so if I go to police, I will just ruin the life of this guy, you know, the guy who raped her. So she had such a low self-esteem that she was worried more about him. That's a big issue. So we see that structural issues in the countries of our region are quite similar. Stigma and this feeling when the rights of sex workers are violated, they think that it's normal. And this is something we really need to overcome. Archel, thanks a lot for joining us, and thank you. So we had with us Archil Rikhviashvili, our colleague from Georgia, who participates in implementation of React in Georgia. So we would like to thank our regional colleagues. Without you, people who directly work with those whose rights are violated, implementation of React would not be possible. It is based on this bottom-up principle. So now I would like to go to the next session of our event, which is very important, and it will be a Q&A session that we have announced before. So I would ask our speakers to join us now. I hope that you are still with us. Those who made presentations, Marina Novachuk, Olga Varetskaya, Tatiana Deshka, and Mikhail Galichenko. And I will ask you the questions that we have received throughout this event today. And first of all, I would like to ask Marina Novachuk. So Marina, your presentation was the first one, and you mentioned the 10-10-10 targets set to be achieved by 2025 to reduce stigma, to reduce criminalization. And to improve the situation for key populations. And to be honest, that this targets look quite ambitious, because we'll have 2025 quite soon. So to achieve those targets, what are the main obstacles that we need to overcome in the region? What should be the focus of our attention? Marina? Thank you for your question. And I would say that, you know, the word ambitious, I use it too, but I would rather say that those targets are motivating rather than ambitious. You know, by 2030, we have the target to have 0 cases of stigma against people living with HIV. This target is even more ambitious. 10%, that's quite a challenging target, but we hope that it will be inspiring, it will be motivating, because we have countries in our region and all over the world which already achieved such results. And it shows us that it is real, it is possible. Of course, we need to have several factors: political will, we have legal framework, we need to have strong civil society, and a readiness to change. And all those factors need to be present together. And they can bring to the required change. But it is still not an impossible goal. This goal should be inspiring and should be motivating for us. For example, in the fourth cycle of stigma index, it showed that Ukraine is quite close to this 10% of stigma towards people living with HIV and people with suspected HIV, and we hope that the next round will show even a better result. Of course, the reports for Tajikistan, Georgia, Turkmenistan, they are quite different. Here we are talking about 60 or 70%. So the situation in different countries is quite diverse. As for the laws, also, we can look at the UNAIDS reports, regional reports, and of course, there are a lot of things to be done, but a lot of things have already been done. And now I work in Ukraine, so I talk about this country quite often. So there is a law about on HIV, and there are other draft laws and regulations which should change the situation with the discrimination. We should change the allowed amounts of substances, etc. And if we have this political will, we will realistically be able to come closer to those targets. And I hope that those targets will not stop the partners, will not make them believe that it is not possible to reach those targets. And the key barrier, if I had to name it, I would say that the key barrier is stigma and discrimination, because that is like water goes to the sand. It is everywhere. It exists in the society. It exists inside the key populations. Like when a person thinks that if I was fired from my job, probably that's how it should be. If I am discriminated, that's probably how it should be. So there is a lot of self-stigma in the communities. There is a lot of stigma in professional environment, and a policymaker, if he has a negative attitude to certain key population, probably he wouldn't vote for certain laws and regulations. People who are making budgets, probably they wouldn't support allocation of resources necessary for the response to the epidemic, and we need to work on it. We need to address this stigma, and as React shows us, we need to make these efforts on an ongoing basis to decrease the level of stigma among professional circles and in the society in general. Thus, we will step by step come closer to those targets. Though, of course, we have a lot of things to do in future. Thank you.
Thank you very much, Marina. It's a very inspiring answer. And I have also a question for you from Olga Vilayeva, a person from the audience. It's much more specialized question. I don't know whether it's particularly to you or to someone else. So what do organizations responsible for implementation of GF grants and UN agencies do to get OST to healthcare facilities in Belarus and Kazakhstan? So that's probably a question that is very important for our audience. Yeah, that's an important question because it's one of the key populations that are very relevant for our region. Let me start with saying that the United Nations does not provide grants, only the GF provides, and the guarantors of implementation of of the grants are so-called principal recipients. The organizations that exist and work in every country, Belarus, Ukraine, Kazakhstan, they guarantee that this application that was approved will be implemented according to the principles included in that application. So I can still tell you what UN does. The United Nations agencies work closely with the Global Fund, including UNAIDS and World Health Organization. We work closely and we are part of coordination mechanisms on grant implementation in all the countries. We are a part of coordination committees and observation committees who check how the grants are implemented. So we can observe how specifically OST work is done. We ask questions, we learn about the problems and try to help resolving them. And in addition to this work, the UN structures together with our partners continue the advocacy for the fundamental principles of the OST. And that's a very good, well-tested method of prevention, supported by UNAIDS, supported by the WHO, and at all advocacy technical meetings, we always support it. We know that there are some violations, we raise the issues, we discuss them, because another important function of the United Nations, in addition to technical and advocacy support, is creating those platforms for dialogue, those partnership bridges to get together NGOs and governmental authorities to discuss important issues and find solutions to them. So that's my general response. because I do not represent directly the organization that provides the grant or implements it. But thank you very much for this question. It's important. Thank you, Marina. Thank you for your response, and thanks for participation in our event. And the next question is to Olga Varetskaya about because it was her order in terms of presentation. Now, Olga Reakta has been working for a year in Ukraine, and by now in the Alliance for Public Health, the work of REACT in Ukraine is actually coordinated by the colleagues who have certain relation to monitoring and evaluation. The area that you coordinate in the work of the APH. Before, in the monitoring and evaluation, have you encountered the data from this area, human rights violations, or is it something new for you? Thank you very much for your question. Yeah, the question is totally right. A significant part of these violations had been on our radars before that, but if you speak about monitoring and evaluation, that's an opportunity to systematize everything and understand what first steps needs to be taken. As even today, we emphasize the same types of violations, the same risk groups, and people who inject drugs were mentioned on numerous times. And we also spoke many times about the need to work with police officers and health professionals on OST. Well, we used to hear about that too, but now we do have evidence which we can use to advocate for certain points with public officials to conduct systemic measures, because something must not work properly in the training sessions that we've conducted. But maybe we need new approaches because it doesn't work as we wanted it to work. So that's the next step. And I'd like to draw attention to the fact that that's a very important step. And all the activities today are useless unless we make the next step and offer a new breakthrough in our advocacy, in our training activities, in our legal aid support. So I think that's the key point now. Yes, thank you very much. And let us talk right now about the next step, because this is the first presentation of the results of work of REACT. It's the first year. What is going to be the next step, and what we are going to work with in a year or two? With which activities and regions of Ukraine are we going to work? What's next? Thank you. In a year, we are going to have a full picture for the whole of the country if we speak about Ukraine, and we'll add more countries if we speak about the region. So certainly we will have more cases that will better reflect the real structure of violations of key populations' rights. We will be better at analyzing the situation, and some practices I hope will change within this 1 or 2 years because of the advocacy and trainings. Maybe some violations we speak about now will disappear. For example, confiscation of the OST drugs. I hope it will be finished one day. And on the other hand, it will be the same situation like with HIV testing. Before the number of cases drops in the statistics, it will grow. And it's good, because that means that key populations trust us more and are not afraid to complain about the violations of their rights. Thank you very much, Olga. Thank you for this vision, for this perspective about the future work, and thank you very much for your work that you do. And the next question is to Tatiana Deshko. Tatiana, you have been speaking broadly about is the EECA region 4 out of 5 countries where REACT is implemented, where the REACT works and provides evidence. Now, the situation is quite different, especially with regard to visibility of key populations and their position in the society, and the legislative framework is also different. So how difficult it is to work with the same system in different countries, and did you have to actually significantly adapt the system to each country, or the system is flexible enough to be used in different contexts with minor changes? Tatiana, thank you very much. Yeah, for every country, we developed a React that was customized, tailor-made for their needs. And though you see that some analysis is common, like you can use the breakdown per perpetrators and cases and types of victims. Nevertheless, the list of parameters is different, and it's individual in every country. So another country can copy that, but usually there are some points that need to be taken into account more specifically. And I would like to share our plans about further work on React, because that's a great mechanism that now works for human rights for key populations. And now our partners, our colleagues from Frontline Aids, that they have refined it even more for it to better register gender-related aspects of violations and emphasize the gender issues. The situations in the countries are quite different, and now we are at the initial stage, and it reflects who works with which groups. But after we scale up it, I think we will see a more objective picture for the countries. Thank you. And in all countries, but in some more than the others, it is probably impossible to do a registering of human rights violations. I'm not even speaking about response without a positive interest from the authorities. So according to your experience, are the authorities interested in implementing and developing React in the countries where it is being implemented? Yeah, thank you. We are at the stage when the analysis of the work has been completed. We expect we are presenting now the reports on every countries with some legal recommendations, and we expect that the presentation of the analysis will be conducted in every country on the national level, involving a broad circle of stakeholders. But of course, first of all, involving law enforcement agencies, health professionals, public authorities, and we hope, we really hope that when they see the beautiful opportunities the React opens, how it allows promptly responding to violations, how it prevents more critical situations, I think there will be even more interest from public authorities. But look, today with us we had a representative of Public Health Center, Igor Kuzin, was welcoming us. So we are proud to have such partners in Ukraine, and that's one of the signs of how the state values and wants to use such tools. Thank you very much for your response, and that's a really inspiring example, and we hope that further in all the countries where this system is implemented, the partnership will continue to develop, and you cannot change the situation with the human rights without changing or improving the communications with the public authorities. And the next question I would like to ask about it, I'd like to ask Mikhail Golichenko. Though first I will ask a more specific question from the audience. Victor asked Mikhail about this. It's specific, but it's interesting. In Ukraine, there is a problem because the police have their internal database about all the detentions and even suspicions about the people they don't like. That's what Victor says. And he is an OST client, and He was detained and they took a tablet of OST methadone and they started a criminal case against him, and this prevents him from getting employment. Is this not a violation of human rights that the policeman provide information in this database without a court decision? So that's a question for Mikhail. What would you like to answer, if that's the right thing to ask you?
Well, yes, I can respond quickly that, of course, registries exist in all our countries. It's not only for Eastern Europe and Central Asia. It only exists in the USA, for example. Of course, we need to respond to this situation, go to the court, do something about it, because this register was first of all aimed to be a narrow system of tools to allow the police to see data about people inclined to commit offenses. But now it is really such a big monster which is used by police in our countries to just keep record of people committed even minor administrative offenses, and then to manipulate those people, trying to get some information from them, just in case they have some offense committed in the location, where to check if there are any people in there with prior history of detentions, etc. But also they can, sell this information. For example, employers can ask the police to check if a potential employee is in this register or not. So I think that our question is about it, actually. So I think the only option here is to go to the court and protect your rights in the court. I do not see another option to do something about it. Thank you for your response. Actually, when I read this question was to say that it is actually an internal database of police, but probably some employers, they have access to this database, and we have this practice in Ukraine. We really need to change it. So from myself, I'm not only a moderator, but I am also a coordinator of React in Ukraine. So please contact us or any other organization implementing React, and we will try to provide a consultation to you and do something about this situation. And we have a more general question to you, Mikhail, because you are an expert in different international practices related to the protection of human rights, in particular key populations' rights. And in our region, not only in Ukraine, we still have to explain how human rights issues are related to the effective response to HIV and tuberculosis. So where are human rights and where is epidemiology? And how those aspects are interrelated. And sometimes we even hear from people that to effectively respond to HIV, tuberculosis, and other dangerous diseases, there should be kind of a strong iron, arm of the government which should be dictating here what to do. So how can we respond to this kind of arguments? We see this discussion also in terms of the COVID pandemic and who needs to have this discussion with the society. I think that the example of tuberculosis is quite good here and quite demonstrative. When the government is saying that they have overcome the issue of tuberculosis, except only 2% of people who are hard to reach for the government. and those people from those populations rarely seek medical health. What kind of groups are those? Those are vulnerable groups in terms of HIV, tuberculosis, in terms of alcohol use and drug use. And those vulnerabilities are actually related to criminalization of certain behaviors and conditions, stigma, which is often promoted by the government and government agencies. And due to this, all those factors, people are losing the possibility to realize and implement their rights, which they have according to Constitution, because our Constitution doesn't say that health status, means that a person is deprived of their human rights, because rights are often closely related to health status, unfortunately, and changing the situation without improving the legal status of people from key populations is not possible. Here we need to view social and legal support as a separate category of services, which are as important as medical services, which are as important as prevention services. So that's the response I would give. Of course, there are certain issues related to separate diseases, but the general answer is like this. Thank you, Mikhail. Thank you for this quite convincing, I think, response. And I would like to thank all our speakers, all the participants of our discussion. I would like to thank Marina, Olga, Tatiana, and Mikhail. And I would like to say a big thank you to all people who were watching us, who were listening to us on Facebook, on YouTube. And those first data that we received from React and presented today, we will publish them on the website reactaph.org, and we will be updating this data in the real time. So ahead of us, we have a lot of work. This is the first event of this type. This is the first presentation that we are making. And we already have some recommendations which were presented in Tatiana Deshka's presentation, in Mikhail Kalichenko's presentation. So both to the government and to the civil society sector. And responding to the last question, Mikhail said, I will rephrase a little bit, that if we want to overcome HIV and tuberculosis, and even if someone doesn't like it, we need to observe human rights. And we need to observe it even in relation to marginalized and stigmatized populations. Someone may not like them, but human rights are for everyone. Also for the key groups and vulnerable groups. So we need to improve situation with human rights, and this is the aim of the React tool. We have only started this work, and of course it is to be continued, and we hope that our further work will improve the situation for everyone. Thanks a lot for your attention, and see you later. At other virtual events and in the offices of our NGOs. Please stay safe and have a great and safe and healthy day.